Good evening, everybody. Welcome to the Wednesday, March 11th, 2026 edition of the Finance Committee public hearings. If we could call the meeting to order, and if we can start by standing for the Pledge of Allegiance. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you, everybody. A couple of things. First, the approval of the minutes, since I forgot to email them out to everybody. That is obviously not happening tonight. So they may happen tomorrow or on the agenda next week. I apologize. I think my real job kind of interfered with that. The Collins Center report update, we're going to keep on. I'm hoping one night next week to talk about that. All right, so if I could have a motion to open to continue the public hearings.
So second.
All right, so I have a motion made by Mark to open the public hearings for the May 4th annual town meeting and the May 4th special town meeting, and that motion's been seconded by Becca. All those in favor, raise your hands and say aye. Aye. All those opposed? Any abstentions? All right, so our first item on the agenda is we have police department and fire department tonight. I'm going to take all the articles that the budget parts that are under the fire department first. So, and then we'll do the things that are under the police department second. I do want to state that the VNA, which was in the budget when it was originally submitted, no longer exists as an enterprise account because we dissolved that. It'll be gone by June 30th. That was what town meeting did at the special town meeting. So that will all be rolled into whatever we talk about with public health nursing. Okay, so I have the fire department, and then I believe we have substance abuse prevention and not crossing guards, and public health nursing. Those three, and then the articles for the fire department capital on the annual and the special.
Madam Chair, fire department starts on page 33 in your packet dated 2/26/26. Page 23 for the fire, 33 for the fire department.
Thank you. Page 33. If anybody is watching and doesn't have a copy, but you do have a phone or a computer, all of this is online under the town, on the town meeting tab of the town website. There's a town meeting virtual table for the May town meeting, and copy of the warrants for the annual, the special, and the budget are all up there. As well as 400 pages in the PDF backup documents. Page again. 33. Of course, I got it all mixed up out of order. If you guys are ready, yeah.
Good evening, Chair, Finance Committee. Thank you for having us here tonight as we present our FY27 budget. Before reviewing specific items, the environment of the departments operating across Massachusetts, but specifically Stoughton, really we're seeing increased volume, especially heavy on the medical side, although last year resulted in 30 fires. That's mutual aid and Stoughton, majority in Stoughton, but still requiring quite a response. For the Stoughton Fire Department, our primary responsibility remains ensuring when a resident calls 911 We have the personnel, training, and apparatus ready to respond safely and effectively. The FY27 budget is structured to maintain that readiness while responsibly managing our operations. I would refer you to the notes at the bottom of your budgets that you had received. Those are our asks and changes. I would remind we stayed at a 2.9 overall increase. And I'm here to answer any questions from the Finance Committee.
Thank you. I'm going to open it up to questions from members of the committee. Marty?
Hi. My only question is on page 34 of the expenses, about a fourth of the way down the page. It says building and collection admin service increase of $10,000. I'm hoping we're going to collect more than we spend to get it.
So when, that's always been a interesting component of our budget. The more you see us ask for is a result of our more collections and more money going into that general account. We pay the billing company 4% of monies only collected, right? So typically we may fall short because we project out, based on the year before, what, 90% or 90, as high as we can to a point. But last year, I think we brought in 2.8 million, close to 3, and we're tracking that same as this year. So the more you see of an increase in requests from that, that means we're collecting more money and more money is going into the towns.
Okay. Any, Becca? Becca's going to ask you a couple of questions. One is on behalf of Joel, who could not be here tonight.
Oh, sure.
Yep. So Joel Wolk had asked, the motor equipment repairman, what happened to this position?
Yep. So back in March of 24, our mechanic moved on. So we put it out for a position within the department because we do have a couple of diesel mechanics there. With no responses from that, we put it out internally town-wide as per the town bylaw and then throughout really the country, I suppose. But we had 3 applicants. The one qualified applicant was interviewed and we offered a position to. Sent a text to the assistant chief here at 6 a.m. with his start time at 8 a.m. that he wasn't going to take the position. So we had to really scurry to fix that. And what we did is and it's very common, most of our little stuff is fixed with DPW mechanics, but we tend to swamp them. And we need to have an emergency vehicle technician by rights to work on the fire apparatus. So we worked out an agreement with Foxborough Fire Motor Squad, highly qualified mechanic. As a matter of fact, he was just awarded like one of the top 3 mechanics in the country last year by Firehouse Magazine. So very confident in his work, in his team. And so it's been a big lift to try to get things up to a position, but what was happening as they were invoicing on the finance side, as they were invoicing, we can't take from a salary line to pay invoices. So all we did was move it up into that expense line, right, to pay, because when they bill us for labor and parts, it only made accounting sense, I guess. And the accounting didn't want to keep yelling at me for trying to take from one and move to the other.
You got in trouble?
A little bit, yeah.
Okay. The second question, thank you. The second question Joel had was, the new fire station has a special equipment repair bay. Are we not using it?
No, as a matter of fact, so I had some lofty goals and I still continue to. I'm not staying away from that. My goal was to have our own Stoughton Fire Motor Squad, where we would actually underbid basic maintenance. And this is, I was going to, not in a bad way, looking to take advantage of mechanics are very hard to get, especially emergency vehicle. I wanted to kind of mirror what Foxborough does because it actually makes money for their town. They probably have, I don't know, I would say 15, but sometimes up to 30 on specialty things of other municipalities, like Franklin is a big client of theirs. They've brought in some really good money for their community, and I was trying to mirror that. When we designed and built that, it was to actually put the mechanic in place, but then as he left, continue and let's try to do this. I'm hoping to actually offset some of our costs by, once we get all of our stuff all our equipment to just a preventive maintenance part, have them satellite out of there and capture all the towns. Easton's mechanic just left probably 2 months ago, and they were serving towns like Whitman, West Bridgewater, like this part. And so I was like, can we work out of here? I know I'm going on, but my ideas aren't horrible, but they're tough to get through. So that was the goal. We have equipment. They come over there. They work in that. You know, when they're working on our apparatus, it doesn't send our stuff sitting out in a parking lot over there. It's protected. So anyways, long answer to, kind of vented too, by the way. Thank you for listening.
Madam Chair, I'd like to add just a bit to that. It won't be as long as Mike, I assure you.
It's not like it's a hot topic. It's not like it's a hot
This
topic.
is one of those issues that we face in almost every department. We either outsource or we provide it in-house with quality service. This is one of those cases. I agree with Mike. Mechanics are hard to come by. If you don't hire the right person, you have nothing but problems with your equipment and with the person. So until we can find that right person, this is one of those cases we prefer to do it in-house. But until we find that person, we will continue to either use DPW or Foxborough. We're not going to hire an inferior mechanic that causes nothing but problems like the last one. So I agree with Mike and everything you just said. This is a decision we face with almost every department. How can we do more with less and spend less money?
It's
Thank you.
also finding the right person for the job, and that in certain areas is very difficult.
Correct.
Chief Makem or Assistant Chief, just to double down on town manager
I can't
and what the
promise you
chief
this
said.
will be short.
Foxborough Motor Squad comes to our maintenance bay in Stoughton and works on our equipment.
Thank you. Okay.
My next question is, this is for me. How is everyone enjoying the new building?
I can honestly say we have had a big turnover in personnel, and I only say that because you had to really experience Freeman Street to appreciate where they're at now. I would say everybody really enjoys it, and people from the outside that come to visit. I just had the Stoughton High basketball team there to kind of do a walkthrough, but also give an option of another maybe career. And they were amazed. And I was just over in Brockton yesterday for a memorial, and one of the firefighters stopped me and said, I gotta tell you, we covered your station, and I wish, and they just built a public safety building. They're like, I wish we built something like you had. So I was pretty happy with that.
Do you find that the maintenance costs, the maintenance costs of the new building, like, are we finding cost savings from having to maintain the old build? I know we redid the old building,
I
but
think overall, yes, definitely. I mean, we were catching rain in buckets there, but it's amazing how a new building can, yeah, I believe as far as maintenance and whatnot, it's just, these all cost money to operate. It's a whole different world. They all operate out of a computer in the middle of the building, you know?
Yeah.
But so there's some learning curves, but yeah, no, thank you. They're appreciating it, I believe.
thank you.
Yeah.
Mark?
Thank you, through you. I'm happy about this one. I just wonder if you could elaborate a little bit on it. Oh, you there? All right, good. This one I'm happy on. Usually I'm asking, do you have enough? And this time you actually doubled it, looks like, for the in-service training and education.
Yes.
I'm glad because I always ask both you and the police if it's enough money in the budget. You guys always say it, and this time it's
No,
more, so.
yeah, thank you, Mark. Yeah, no, it's important. It's vital. We have a very young department, which is great on one end, but without experience, we need to really train them up. It's the only way to get them really fill the losses of experience, and it was vital for us to really focus on training and in-service training.
Like I said, I'm just glad that
No, thank you, Mark. I
Thanks.
appreciate that.
Any other Heidi?
Hi, I'm looking at the overtime,
Yes.
and I'm asking this because the police just hired like a ton of people. And one of the reasons they were able to do that is because of the civil service testing. I don't know if you guys do that. But, is there a way we can begin to hire more people so that number can get lower?
Oh, absolutely. No, I'm kidding. Yes, the overtime, we have a minimum manning clause in the contract. They have to maintain 11 personnel on duty to respond at all times. That gives us our 2 ambulances. And I'm sure if you drive through Stoughton, you hear those ambulances are going nonstop. But yes, when we are still in civil service, we do have some positions to fill. The only thing I'm waiting for is the new results from the civil service test come out next month. And I pulled the list, and all the people they gave me already have positions elsewhere. It's really kind of timing it right. So the minute that list comes out, I already have actually a request, I guess, to hire, right? And we will fill those positions right away.
How many positions do you have open right now?
So right now we have three positions open. And I say this because I've learned this over the 31 years here, but also, hiring in groups is great, but you want to give a little bit of space. If you have, if I waited and hired all like 10 individuals at once, that's 10 first-year probationary firefighters. It's really tough to place them, and then they can't they can't drive the engine till after a year on. So then I could possibly wind up with 10 firefighters who cannot drive. That's really tough pushing the truck up Park Street, but no. But I try to stagger it a little. We do have some positions to fill, but we're doing okay as far as that. And as far as civil service, it's an obstacle, but we get around it.
Okay. And I had like 3 questions and my one big question. And then I used to be on Muni Ops, and I know that in the past you've gotten bulletproof vests, and then I think that you ended up getting some sort of grant to pay for them.
Mhm.
So when I was looking through the budget, I was looking for that, and I don't see that. So is that something that hasn't expired yet? 'Cause I
Yeah.
know they expire like every 5 years or something.
Yeah, I think they're a little bit longer than that. We have the ballistic vests and helmets. And when we go to replace, I don't know whether a 10-year, because we don't wear them every day like the police. They're actually in a piece of apparatus. If an active shooter or a hostile event occurs, they respond in a stage, staying back, and then put the vest on. So it's not like they're worn every day like the police wear them every single day in every shift. So I think we get a little bit more life out of those.
Okay, so that's not something we would necessarily see in a budget line item?
No, but you would see it on either a capital, or I would really certainly try to get a grant. It's a hot topic for grants. So I think it's a priority when I fill out the grants. Usually they tend to give those
Okay, thank you.
Thank you. No, thank you.
Good evening. I noticed on page 33, there's an in-service training, which has no expense for fiscal 2026 or 2027, but it had an expense of 51,152 for 2025. And on 2025, on in-service training, it shows another $8,529 for fiscal 2025. What is the difference between in-service training on page 33 and in-service training and education on page
Yeah,
34?
so
These are interchanged, right? So we're no longer showing it in the
if you want to answer.
It's just a curiosity thing.
No, I appreciate the question, and I know it's a little confusing, and we did try to change some of the names, but it's kind
If I
of,
may, Chief, it's between salary and expense.
and I understand that, it's just the names stay, so, but the assistant chief actually has the answer, because I'm looking it up here.
Yes, through the chair, please. This specific line item has been put in place where it says overtime in-service training, that in-service training. So we no longer are using that in-service training line item, and we transferred the line item to overtime in-service training.
So it's just renamed.
Yes, sir.
All right. so
Thank
the-
you.
And just to follow up on that, if you don't mind, so that was to pay, that line in the salary item is to pay for the overtime for people to attend the trainings. And then the cost of the trainings themselves are in the expense.
Correct.
Thank you.
Exactly, yes.
May I just ask one other question? This is another curiosity question. How do we stand with the new fire truck? Are they on time?
So yes, we're actually, I was lucky enough to, I say lucky enough, we really bothered them and we got on what we call a fast build for Pierce. What it does is we had to, the problem with the apparatus is countrywide, but a lot of fire chiefs, I would say, they want these custom trucks. We only have, by getting on this, we'll have that in less than a year at this point, which was a 4-year basically request because we could only do 10% custom. I'm like, absolutely, we don't need, tricked out apparatus. we need a lot of trucks. So working with Allegiance, the vendor, I'm like, is there any way we could get on a fast build ideally? So it's already in production. We're not waiting in line.
Thank you.
No, thank you for the question.
Jonna?
Thank you, and through you. Can we assume that there's less financial burden now that the hotels don't have the illegals in there anymore? So now we're not getting those those calls for like stomach aches and headaches to go to the hospital?
Yeah, so I don't think I'm not sure where they left in July probably, but our call volume last year compared to the year before, 24 to 25, still did go up. That did incorporate some of that. We have some serious responses and conversations with the assisted living in the facilities that we do respond quite a bit to. So our call volume has not dropped. It's actually gone up another, I would say, 18% over the year before. The storm, over 62 calls. I mean, it's hard to say that took away because something's always coming around to pick something else up, I suppose.
Okay, so there's no decrease. Okay.
Yeah,
thank you.
and when you say a financial burden, you call, we come. I mean, it's not it's a service we provide to the community, and I don't really put a number on that as much as when the ambulance billing goes out and whatnot, that is certainly a finance part to it. But if there's a motor vehicle accident and both people are uninjured, that's a great call, right? And And we hope for that. If somebody needs services as far as transport to the hospital, it's what we do. So I don't really kind of measure it like that. And I understand it's a FinCom, and I do, and I think we're really tracking right on bringing in the right amount of money. Yeah, I apologize. I don't really put incident numbers to money made or money lost. Yeah.
Yeah.
Thank you.
Yep.
Yeah, I would just, I mean, for the history, I know when we abolished the ambulance enterprise fund, it was because, it was hard to be financially self-sufficient, and we thought it was more important to have ambulances come when people needed them as opposed to worried about whether or not we were going to get billed. So
Yeah.
we want to pay for the town chose to pay for the expense no matter what. If we get money from insurance companies,
Sure.
great. But, I would also just like, as courtesy, if we're speaking about people, whatever they are, can we just not refer to them as illegals? Can we just refer to them as, what? No. Yes.
I've been sorry for that.
I really think that I'm just using the correct terminology.
Actually, you're not using the correct terminology. I would appreciate for the order of this meeting that we do not refer to people that way. You could just call them, if concerned about, you can say immigrants that may or may not have been documented. All right, there are other ways to say it. And thank you. We shall move on. Are there other questions? I'll get to the public in a second. All right. I have a couple of questions, just, basic random. What's the status of the repair, whatever the renovations are for the fire station down in West Stoughton?
So we are in progress. The assistant chief just met with them down there. Central Street Station, our station too. Yeah, and just so everybody understands, and I mean, some people just, Station 1 is 400 Prospect, headquarters is 30 Freeman now, and Station 2 is Central Street, 1550 Central Street. The assistant chief met with the contractor just this morning. We've cleared out almost everything out of there. It's amazing how much stuff collects. And then what is the timeline on starting that? We're right around the corner, right? Next week? Weeks, right? Yeah. So we're pretty excited about that. We really, actually, I must say, with the assistant chief, we've really done a good job of 3 really good buildings on that borrowed money of 27.3 million. I really think we did an amazing job. And that's not just us, it was the team,
Right.
And the town with their support.
I like to just know what's going on.
And stop in, please.
So Freeman Street's all done now?
Yeah, but don't come up because my office is still a mess.
All right,
It's like
I'll let you
boxes
know before I
everywhere.
come
My
up, but
mother
I'm
just
not gonna,
came
I'm
up
not
for the
gonna,
first time
I'm not
and
gonna
yelled at
complain
me.
about your office being a mess. But no, thank you.
No, please come by Freeman Street. They did an amazing, it is a top level job, I feel.
Thank you. You got a question, Mark?
Yeah, just to follow up on that one. On Station 2, how much money is left to do the repairs and renovations?
We have enough money to do the renovations. The renovations is going to go in 3 phases. The financial director can speak as in regards to monies left, but there is enough money to do the renovations. Phase 1 will be the 2nd floor, to where we do painting and floor removal and new floor installation. And the 2nd floor will be taking out the old kitchen, putting in new kitchen, and putting in new hardware in the restaurant facilities, and throughout the maintenance space and the hallways, also painting, new flooring. So the building is approaching 25 years old, so it's gonna get quite a nice facelift. And
In Mark, I will get you those numbers, or Biz can give them, but I
Okay,
just
yeah.
want to be cautious, since this is a public meeting. I know they were waiting for some bids back from a couple vendors. So we don't want to show our cards. But you and I
Correct.
can talk and I can tell you exactly but we have plenty of money left over to do what we
Okay.
need to do there.
I just wanted to make sure that,
Yeah, no, absolutely. I
not
appreciate the
another,
question.
all right, we need,
Yeah, we're not trying to hide anything. We're just,
Right.
No.
Mike's up, but. I didn't-
understandable.
Okay. All of a sudden the painter's
Okay.
bill.
Concur with the chief. No,
The
we,
painters
yeah, the
invoice.
town's
That's
been
fine.
outstanding in supporting this and we have the funding that we need for the renovation.
Thank you. Any members of the committee have any questions right now? I'll open it up to members of the public. If you could just come up. Cynthia, you can start first. State your name and address for the record.
Cynthia Walsh, 1096 Park Street. Would you please remind your members that I can't hear if you're not speaking into the microphone? And having the microphone out here isn't helpful. Please bring it to your mouth. I'm missing important parts of the meeting. I am the chair of municipal operations and I am an elected town meeting representative. I expect to be able to hear at these hearings. They should be open to everyone, including the disabled. And on that topic, I have twice last year I had to call. When I fall, just like the TV commercials, I can't get up. So I call the fire department. It takes 2 people to get me back on my feet. Some of you can imagine how humiliating it is to have to ask people to come to your house to pick you up off the floor. The people that respond have never, ever, ever made me feel like a burden or a joke or anything else. They've always been extremely professional and kind. They always get me in a chair, make sure that I'm, I guess, compos mentis, and that I don't need an ambulance. They do not send an ambulance because I tell them I'm fine, I'm just on the floor. And I just want to say, it eases the pain of being disabled and having to rely on other people when you meet folks who treat you like a human being and not a burden. Thank you.
Thank you, Cynthia. And even if your heater's down, we'll come try to take a look at that too, right?
You said you would.
We did.
Unfortunately for you.
We got someone there though, working with the police. It was, yeah, anytime.
Well, the firefighter that happens to be on this board and his brother did such a great job getting my heating back up that the company that usually does the repairs asked if they needed a job.
Yeah.
Okay, Lisa, and then when you're done, could you please just bring the mic up here, please? Or at least at the table there.
Of course, I wouldn't hang on to it.
Thank you.
Carolyn. Yes. So it's Lisa Lyons, Precinct 2. So I had a question with regard to the Public Safety Wellness Coordinator. So I see, and I believe from previous meetings, that this position is moving from the fire department into public health or safety, whichever one of the
Okay, yeah.
departments that we're doing for tonight.
I've
So,
been asked if you don't mind coming forward because then you don't, that doesn't show up on the camera and where this is a public hearing.
sure, where would you like? Right here? Okay, hopefully this is good enough. No?
Yeah, I don't really know how all the cameras work. I just know that, sometimes they're not seen, so
Heidi, can you go ask?
you can go
that
check,
Lucas if,
Heidi. Thank you.
We're good? Okay, thank you. Okay, so again, back to the Public Safety Wellness Coordinator. So like I was saying, I think from listening previously to previous meetings that this position is being moved into something called Public Health Safety. Thank you. So I also noticed that there's another position posted that would incorporate part of what this job is doing. So I'm not sure why this position would be moving into public. So I don't know if the new advertised position is going to be in the fire department or the public health safety. So if the fire chief,
Could you just
So I-
explain what
It's-
position was advertised? Because I just don't know what one you're talking about.
I think the fire chief could do that.
So I think you're talking about, so that was not in our FY '26 budget. That was initially put in and split between the fire and the police. And then I believe it was moved to HR.
Last year it was moved
Yeah, so it wasn't in our FY '26, and that, I think they just technically keep the line item in there, but,
for another year.
yep.
You mean that 5,747.12 that's in there? There's, in 2025, there's 5,747.12 in the fire department. But right, I do recall that position, which is Joe McCrisky's son, I believe. But right, that it did move into, as you just said, Carolyn, into HR. So one, right, this is minimal money. So that's not really my main question as to why it's showing up in fire. I'm just asking about the new position that's hired. I mean, because it's all the one budget. So.
Okay, no, I understand. I just, Tom, if you want to.
Yes, please, Madam Chair. The position did report into HR last year. This same position is being transferred over to what's called the Public Health Collaborative, which is what we presented at town meeting. The enterprise fund for VNA is being eliminated. Wellness, opiate addiction, and the nurses are all part of a public health collaborative. There's no new hire in that office at all. I think the gentlelady may be referring to the job opening in the police department for a grant-funded social worker. I believe that because there's nothing in
That was
the police
that's-
department.
Yeah, that's the only thing I think I've seen posted.
Right. So my question is as a town, do we need two? If we're having the, if we're having the social worker,
I think they're designed for two separate purposes. The wellness coordinator is going to be under public health working on
I'm
you know,
questioning the need for that, given that we're
Right.
hiring a social worker who can do the same thing.
I don't think it's quite the same, but I'll let the town manager explain the position.
Thank you, Madam Chair. They couldn't be more different. One of them is a professionally trained social worker, and that's reporting into the police department, funded by the Commonwealth for every police department in Massachusetts. There's no expense to the town for the first 2 years. The wellness position is a proactive position, working with not only EMS, police, fire, but people from childhood up to senior citizenship and how to improve the quality of their life.
Yeah.
And whose son they are is irrelevant.
Okay. Did that answer your question? I think the way I would think of the social worker position that's being posted is that's somebody that's like, they do like crisis. They come to people that are in crisis, in mental health crises, as opposed to like to help diffuse the situation and see if they need mental health resources or they need to be hospitalized or whatever. So they're trained they're like an LISCW. They're trained to do that type of clinical evaluation. What the wellness coordinator is doing is working with the community and the employees on like health practices and, healthy living, like various things to be healthy, but community education, but it isn't they're not doing clinical social work. There's two different.
And I'm just in general questioning the position because most of us all have some form of health insurance that does wellness referrals for us, as well as our unions have that negotiated in their contracts as well.
I would say when we come to that part of the budget, if you wanted to ask a question about if we need that position, then that'll be a little bit tonight. You can ask that, but I don't think having what I understand from the police department in my experience, like with mental health and like having people come to do crisis evaluations, they're not the same thing.
Excuse me, if I may, when I'm asking questions, I'd like to ask them of the department heads as opposed to somebody on
Okay,
the
well-
finance because they're closer to the
Okay,
issues at
excuse me.
hand.
Well, all questions go through me as the
And
chair.
through you, of course.
And, I understand. I'm saying
I'm
the
just
comments, but
respectfully asking through you, I'm addressing department heads of the town who are
And-
closest to the
okay,
issue.
and I'm explaining for the purposes of people watching this meeting why there's a difference there, and you can ask about the whatever the wellness coordinator position is, for lack of a better name, when we get to that part of the budget.
Sounds good. Thank you.
Any other questions, comments on the fire department budget from people? You can come on right up. Just state your name and address or where you're from for the record.
I'll bring it close. Natasha, Precinct 2, Natasha Gomes. I just wanted to start by saying thank you to fire and police. I'm on Sumner, and so I appreciate when it's dark outside, you guys race up and down this street at all hours of the night, that you turn off the sound. Greatly appreciated. We can see the lights and hear nothing. Love it. Thank you. And I have a few quick questions, so I just want to spit them all out and you can address them.
Sure.
I may have missed it, but is this an enterprise fund is the first question. Second question is, we talked in prior meetings, or I was hearing an average rate increase of around 2.5% on the police budget. I noticed 3, almost 4% could be according to union agreements. We've seen some variance. This is with the assistant chief and the captains. The captain, I don't know if it doesn't seem like there's a personnel count change. I also have a question about the increase in the data. The budget went up really quick. Now I'm not seeing it. It went up to like 40,000. Oh, 10 to 60. Data process and incident command software. I don't know if that was a capital expenditure that was listed. And then I don't see any borrowing at the bottom of your budget. So not sure if that's applicable.
There would, just for the borrowing, there wouldn't be at the end of the budget because this isn't an enterprise account. It's just any borrowing they do shows up in the regular town budget for debt service. And if you wait, they can answer your other questions.
Yeah. Don't run away. You hit me with a lot there. You're taking off. I will refer to Biz on, I can say our overall budget, which we were, requested to stay under 3%. We came in at 2.91 as far as specific line items. Did you want Biz to answer the enterprise account? We are not an enterprise account. That ambulance revenue goes into the general account. And did I miss one? I know I did. The data processing, sure. So data processing, as you could imagine in today's world, our technology, you develop into a software. We changed into a different software. I had 3 different software programs, one for ambulance responses and patient care reports, one for fire reporting, and then there was another one for notifications. Brought that all under one umbrella called First View Software. It's an annual subscription. Initially, I got to tell you, 4 years ago, I thought it was a one-time thing, but this is where every subscription gets you. They keep hitting you. But now what I was able to do is everything is covered, and this is mandated reporting to the federal, fire administration. And so we have to, it's called NARIS, we have to submit every month all our runs, incidents, and they basically do a community, and our grants are based on that too. So I can tell you that's really where that number comes from. And so what was the one Biz was going to answer? Okay. So do you have any others? And we did we do push not to use your sirens if there's not traffic.
No, I'm really learning, so my questions are
Oh,
more
yeah.
inquisitive and less critique at this point.
Yeah, and
We
I
appreciate you guys.
and I invite you, with questions, you can come by the station or give me a call or email, and I would be more than happy to talk about any operations or anything else. Yeah, sure.
Thank you. Are there any other members of the community that want to speak on the fire department budget? You have a question, Jonna?
Sorry, through you, I just wanted to ask the question that Lisa was asking about that particular position. Those questions, I have a budget question about it. That shouldn't be for this period. It should be for the police.
It should be the positions that she's asking. The wellness coordinator should be whatever department that's showing up in now, which I believe is going to be public health or whatever that's called. They're moving it from wherever it is this year to the new department for next year. And then about the grant position that they're talking about, you can ask when we bring up the police department, although as a grant position, it's not going to show up in the budget.
Okay, but if I have questions, is this the place to be asking? Because I'm confused as to where to ask.
No, right, on this department, neither questions. When we do the public health, you can ask about the wellness coordinator.
Thank you. That's what I want to know.
All right. We will now move on to the next department that is under the fire chief's umbrella, which is it public health nursing?
Sure.
They'll be on page 53 in your packet, page 53.
And Janet Crimmins is going to join me up there.
Okay.
Madam Chair, by way of introduction as to what it is, I know we've talked about this at town meeting, but I think it would be helpful. We dissolved the enterprise fund for VNA. It could not be profitable or even break even given the Medicare changes. Reduced the staff from 11 to 3 people, a reduction of 8 total people. The only ones left on board from the previous VNA are the 3 senior nurses. That's the new group. That group of nurses is being incorporated into a new organization called the Public Health Collaborative. And that Public Health Collaborative, which we are doing an information session on next month, will deal with citizens of Stoughton only, ranging from birth to senior citizenship, but everybody in between. And it'll include the 3 nurses who will now respond to emergency triage calls without charging. And if the person needs long-term care beyond their triage, then our nurses will set them up with a private service provider who has insurance coverage to provide that service. Also included in that group with the visiting nurses are the wellness coordinator and the opiate addiction educator, 2 existing positions, not new positions. And their plan, as they'll describe in the public information session, is to reach out to Stoughton citizens with a whole host of issues, from addiction to mental health to acute nursing and triage care, and a variety of other services that our folks need. It could be for a young mom who's trying to figure out how to take care of an infant, and there's no charge for that. It's all part of our basic taxpayers-funded services now. So that's the introduction between Janet and Biz. They'd be happy to talk about the implication on the finances. Thank you.
Thank you. Do you have anything that you want to say about the budget, or are you just ready for questions?
I could just really say, I mean, the budget is in the notes, and Janet can really speak to a lot of it. I just want people to understand, this is, our whole goal here is to really bring it all together for the public health community, the community's public health. It's something that had to be really brought in. Their bandwidth was only trying to compete with home care agencies. It just is a lose-lose situation. Now they can really focus on public health. Okay, so I'll be happy to answer questions. I had some things, but I think they'll come up in the questions.
Okay, thank you, Becca. And Mark?
So through you, I'm curious about the how. So I'm envisioning somebody calls 911 because they're having an issue at home, and it might be a mental health issue. They might have a child with a mental health issue, and they just don't know what to do. So they call 911. Historically, a fire truck comes out or an ambulance comes out, and then off they go. Is this going to be any different? How do you triage an emergency?
So let's, and this is some of the confusion, and I just want to be clear. None of the services are going to change from the fire department. You call 911, we're coming.
Right.
Right? If you need a medical, an evaluation at a hospital or doctor section, somebody, they're going to the hospital and they're going to be taken care of by the emergency mental health staff. This is public health. This is preventive disease prevention, health education, emergency preparedness, coordinated with regional and state health programs. It's really a sort of a prophylactic type approach so that we may not have to get there. So if you're going to call public health on that same situation, it's almost a preemptive strike of that call, and we are going to get you the resources, or public health is going to get you the resources that you need. My child was exposed to what we believe was tuberculosis. Okay, now public health and Janet starts tracing that, and we have a couple cases going on right now in the town, which was sometimes, and I don't say, but it was hard for them to focus on when they're also trying to make visiting nursing visits for home health care that they were released from the hospital. And correct me if I'm wrong, Janet.
If I could add on to that, and then I turn it over to Janet, who the supervisor of the nurses. A great example of this, and the reason we use the word collaborative, this resource reports into Mike as the chief. They're not part of EMS. They're not an emergency response organization. But another great example is they will have their own phone number that'll be on all the materials. You may have a mom call in who says, I think my son is doing drugs. Can you guide me on this? You may have a school resource officer who's calling in to say, I suspect that Johnny is struggling because of his behavior at school, and mom and dad don't know about it. Between our nurses, our wellness coordinator, with our opiate addiction educator, all existing employees. Remember, the staff has gone from 11 to, in that case, 5. They will collaborate to work together. Now, Mike's people may do an emergency call, and it may be an overdose. I would hope and expect there'd be a call immediately the next day to the Public Health Collaborative, and where the nurses would reach out to mom and dad. The nurses would bring in the opiate coordinator with them. This has never been done because everyone worked in silos. Everybody was a lone wolf operator. And now by consolidating these resources and putting them under Mike, under EMS, we get most of our referrals from EMS. The other piece of that is EMS may transport, if I may, Cynthia, who's fallen. And she's got us hypothetically a minor injury, but she's released that night. EMS will report that into our nurses, and the nurses will call Cynthia proactively. Do you need any help today? Do you need your dressing changed? And there's no expense for that. It's part of our EMS services, but they don't provide emergency services. From birth, a young mom, a single young mom who's having her first child and has been released after 2 days of delivery, from delivery, may need some guidance. And we want to be there to help only Stoughton residents. This is now not be expanded out beyond that. It's new, it's innovative, and Madam Chair, I won't expand into what mobile integrated health is right now, but if we're successful with Mike and I negotiating with Boston Medical South, we're going to hopefully get them to invest in the 3 nurses, the full extent nurses, so that we eliminate reoccurrences of readmission that are unnecessary. But that's another story for the information session. May I turn it over to Janet?
Thank you.
Am I on? Okay. Thank you. Good evening, everyone. I just wanted, as by way of what Mike was explaining, having been with the VNA for many years, and now we dissolved that enterprise fund, we listen to people when they say they don't want to lose their nurses. So here we are trying to now develop a new program that incorporates public health, which we have been the public health for 100 years. So that budget was incorporated into our VNA budget. Now it's a little bit more because we have other things in the budget with that, but we planned to continue to create programs. Communicable disease follow-up is big. We've already been in touch with all the doctor's offices, all the hospitals that we serviced patients through with the VNA. Feedback is great because unfortunately there are a lot of people out there that fall through the cracks and you cannot bill insurance because they don't require what we call skilled care. So we are there. We're able to do those wellness visits, so to speak. And if they needed something beyond what we can provide, then we're able to, obviously, well situated to hook them up on what they need. We already have a lot of calls that have come in from residents, even medication issues. Just call us because if we can't help you, we'll find somebody that will. So we're very excited to get going on this. We just moved. We're still wrapping up some things with the VNA, so it's a work in progress, and we're very proactive.
Thank you. I think it's an awesome idea, and I know there's a lot of need out there, because I know there's been times that I've known people of like trying to find the resources of where to find this stuff, and it's hard to navigate the various different agencies. So I think there's a lot of potential there. Lauren?
Madam Chair, just a point of information.
Yep.
If possible. I was wondering if we could get the FTEs for the, because it's not in the book. Sure. If we get those numbers, do you have them now or no, or? Oops. Just so if anybody has questions, it answers it.
Okay. What about the substance abuse coordinator?
I think she's.
The opiate? Can you use the mic just so that, okay.
My apologies. Under the Public Health Collaborative, which is the public nurses, includes 3 nurses and the wellness coordinator. In your budget books right now, we still have the substance abuse and prevention. That is a single employee, but that's a different budget, which starts on page 57.
Okay, and as of right now, for this coming year, that's not being merged into this budget yet.
Madam Chair, operationally, they're merged already,
Right.
but in the budget, they're still in the police budget. Next year, they will be in the Public Health
Okay,
Collaborative,
thank you.
assuming this works the way we expect.
Okay, thank you. Oh, I think it's the 1 and 2, if it says at the bottom there, they're saying based on closing the enterprise account. So those are the footnotes, not the FTEs. Right, but the FTEs are 4 people, 3 nurses and 1 wellness coordinator.
Correct.
3 nurses came from the VNA and the wellness coordinator is coming from human resources.
And we will make a note to add this over here. And then with the VNA closing, there was a lot more people over in the VNA. And so you can see that when we get down, we can show you the schedule on that one as well, but it's 4.
Yeah, it would help if you could update the,
I absolutely can.
thank you.
You're
Thank you.
welcome.
Lauren, thank you for waiting.
Hi, Janet. How are you? Just a quick question. What?
Would you?
I'm talking in the microphone.
Yeah, sometimes you have to bring it up really, really close because even if you think it's
Yeah, but
working,
shouldn't have to
it's
react like that.
it's
I'm all set.
Thank you.
So you're gonna have a separate phone number, right, Janet?
We have the same phone number that we had,
Okay. so it's the same-
7011.
So if someone calls, is it gonna be like 3 triage nurses there? Like, how does that work?
Triage as opposed to,
So like if someone calls in
Mhm.
and they're having like, they just got out of the hospital and their knee is really painful.
Mhm.
And like, what would you do? Make an appointment to go see or?
something that we feel as though that we can evaluate and maybe
Yeah.
they're going to need something more than we can give them. Absolutely. And they live in Stoughton, we'll go out and see them.
Okay, and then you'll transfer like to
If we
If
need to
it's
get
an
Mike and his
emergency,
posse
okay.
involved, then that's what we would do. And if not, then we would refer them to a doctor, ortho, somebody like that, then, yeah.
So you guys are answering the phones, not like a secretary or someone from the fire department.
No, we have our own phones,
So it's just the three nurses and the wellness answering the phones, or is it just
just us, with the nurses.
okay?
He's in a separate office.
Okay. And then I think that's it, but I just lost my train of thought on my other question. Yeah, I lost my train of thought. Okay, so it's going to
Happens.
be called directly to you, and then there's 3 nurses that can be spoken to, correct?
Yeah, if I may, Janet,
Yeah.
I don't want people to confuse, like there's 24/7 hotline to call public health. You know, if you have an emergency, if your knee is hurting to the point where you can't walk or you're swelling up, some sort of infection or sepsis, call 911. Most of the post-surgical patients, I suppose, would call their surgeon, their doctor. They would typically say, you have to get into the ER, call 911. I just want to make sure we're all clear that, you know, they're not going to be operating phone lines and doing a 24/7 or virtual health calls. They are a resource, you know, and they will get you that information. But if you call on a Saturday night, you probably won't be responding to the call. I mean, they'll be checking their messages. I mean, it's immediate. They'd probably call us right away and say, hey, you have to get to whatever at 123 Main Street, whatever it be. But I just wanted that clear with this public meeting. I don't want people thinking that it's all of a sudden a healthcare hotline that people can call at any hour. Call 911 if there's a real
I'm just
emergency.
a bit confused because before when you talked about it, you talked about like the medically at home and then.
So what you're confused about is when we were talking about MIH, we're not even close to that. You have to understand that MIH is a huge lift. We need to get the public health component really situated, basically hone in their focus on public health. And that's preventive medication, preventive medicine somewhat, right? Fall prevention and those types of things, but really focus on the public health. Once our public health is situated, the red tape we have to go through with DPH to get an MIH program with community paramedicine and that type of stuff, I have to train all my members up. And, you know, that's going to be really the end goal. But that being said, we're not close to that. We literally just, and that's why I want to point out too, the FTE thing. This is a living, breathing thing, right? We get into Wednesday meetings and all of a sudden this idea of, you know, maybe opioid, having a resource there. Well, maybe we should bring Stephanie into this. Like, this is how it's growing. And that's the tough part about being in a town government, because we have one town meeting in May and then we are trying to get this all worked out, but we want to make sure we do it right more so than try to just kind of piecemeal it all together.
Yeah, because I was thinking the medically at home part, because when we talked about it previous, that's what was brought up.
Yeah, it was opened up early.
And then I was gonna say, this is gonna like really fly and you're gonna need a lot more than 3 nurses, so.
Yeah, and it's
You
not,
know?
yeah, and so we maybe prematurely talked about it.
Okay.
But it is.
I just want to know I wasn't
It
crazy.
is the way, it is the way the future is going.
Yeah, it
right?
works really
And
well.
we want to be ahead of it.
So, Madam Chair, if I may expand upon that a bit to remove any clarity, that is
Remove
the
any
end.
clarity?
We need clarity.
We would definitely do that.
I know you all enjoyed that. That to remove any confusion. MIH, Mobile Integrated Health, as Mike said, is the end goal. And that is proactive care. It's not emergency services. It's not 24/7, but it is proactive care where we would work in collaboration with EMS. Right now, it is a public health organization that hopes to evolve into MIH, which Boston and Milton do right now. And we have a local hospital, so it makes sense. The only reason we've had to talk about it is because we had to defend doing away with the enterprise fund and what we're moving to. It was premature to talk about that end goal line. But we will get there. It will be self-sustaining. It will be very unique on the South Shore throughout the Commonwealth. But right now, it's an 8-hour a day, 5-day a week phone number where it ends by saying, if this is an emergency,
Call
call
911.
911.
Okay.
Did I
Thank
make
you.
it clear? Beyond
Yeah,
that?
now I feel better because I was
Thank
like,
you.
okay.
Thank you.
All enjoyed that.
And if I could just say one more thing, I don't want it to sound like public health seems so broad, and which it is, obviously. But as Mike alluded to, we have deliverables that we really weren't meeting because we were focused on the VNA, and being the public health nurse in name, just scratching the surface of communicable disease follow-up. That's my most important goal, TB follow-up, all of that. But we also have emergency preparedness. We're also involved with 2 coalitions, one which has grant funding that I need to access. And you could be busy with just those meetings alone. Like that is stuff we need to be taking advantage of, and we need to be doing that piece like other towns are doing.
Instead of the home health care.
Oh, and do that too, because we did that standing on our head. So that one's easy.
All right. Heidi, then Arnie, then Ian.
So I really appreciate what you're doing here, and I've already taken advantage of Janet's services at the train station for the opening, and she took my blood pressure just to make sure I was doing well. So thank you for that. I have a question because like there's so many questions about exactly what this is, and so my question is about the launch and how, like, what's going on with that. So I am the admin of 2 Facebook pages in town. And so when I see this, I'm going to blast it, and I'm going to break all the rules, and I'm going to repeat blast it over and over until people are sick of it, so that they know, because we need to educate the town that this is what's going on. And so I just want to know how this is going to be marketed, how we're going to do the publicity, what can I share to those groups that I manage, but then other groups that I'm in. So everybody's like, oh my God, there's another post from Heidi.
Yeah. No, thank you for that. We do have an information session planned April 22nd, maybe. But we literally just had a collaboration meeting today. We've been having them weekly, and it's to get the website up and running, to broadcast what programs that we're going to be having available. So absolutely would take any help that you can to promote what we're doing. As far as premature promoting, maybe not, right? Like if you want to put something on there. We have a Facebook page. We just updated. Tomorrow. Okay. Tomorrow's a good day. As far as I know.
It was on the agenda for this week.
Actually, it is, because if Teresa's watching, she'll probably yell at me. She was working on that today, so.
Is it Stoughton Public Health?
Yes.
Public Health Collaborative.
We have a new little logo, but I think if you put Stoughton Public Health, that's what's going to come up.
Thank you. All right.
Feel free to share.
Arnie, thank you. Thanks, Mark.
Hi. Just getting back to the budget. There is the salaries for the 2027 budget. What was the salary increase from when they used to be in VNA to the 2027 budget
Just the 2.5%.
on each of the people? Thank you.
Ian, I'm sorry.
Thank you, Madam Chair. I think I just want to kind of echo Heidi's point, because I think with this is a, it's exciting change, but it's a huge change. And that's that kind of communication, getting the message out. And, Facebook's great, but not everybody's on Facebook. So I guess my question is just, there's a $2,000 line item for advertising and freight, which I think probably doesn't address that kind of public outreach, and wondering if it makes sense to have something like a dedicated line item for outreach going forward, especially because as we move towards the MIH model, we'd probably want to communicate hey, our services were great, they're even better now, and let people be aware, because I think they're just the conversations come up from this, just within this room, is people have a lot of questions and want to know more about.
Madam Chair, if I may, Ian, great point. We communicate all the time about how to get it to the next level when that time comes. This is about a month old now. We've come up with ideas like communicating with the clerk's office on newborn babies and sending out brochures to new moms, giving the public information session here and at the COA to seniors so we can make it clear as to what kind of services would be available to them, talking to the mothers of students about the opiate program, talking to all groups from childhood to seniors about wellness at every age, diets, the whole deal. So again, the whole strategy is from birth to late stage life and all the challenges in between, and communicating with all of those user groups. It'll be it's exciting to me to hear that it's exciting to you. It's going to be very unique to Stoughton. And again, we're doing this with 7 fewer employees. It's not like we're adding 7 employees to provide this. It's just a better use of our existing resources.
So if I may just, do you feel like you have the budget to do all the necessary outreach?
You make a valid point about promotion and advertising. If there's a place we need help, it should be in that area. And I'll find the money internally to kick it off when they need it. Janet's not afraid to plow right through that door with a hand out looking for money. So I'm sure she'll do that. But we just want to time it at a time when we can
I
answer it.
suspect like next year in the budget, we may see more of that as they get going.
Yeah, and I have to say, in doing some research, there are a ton of grants for public health, a ton. And we really haven't even scratched the surface on that. And part of a lot of those come up as marketing, right? And getting the information out there, because you remember, it's for the whole state, but diverse communities, right? Being able to get out there where people may not have the means of Wi-Fi and getting on social media. So we will definitely be approaching that too.
I mean, that's great. And then probably also add, in different languages as well for our community.
Their brochure is
And that's what that PN5 that we belong to, we can utilize them to do that for us too. They do assist with advertising in different languages.
Thank you. Laura?
So I completely agree on, communicating this out, making the public aware, and that there should be budget for that. I'm just worried that 3 nurses is not going to be enough, even if you are limited in scope, and that this is kind of a path to a different model. But in the meantime, you could have overwhelming, response to the outreach, or, once people understand that this is available to them. So I think my question is there a plan for scalability in the meantime before it goes over to an MIH model, but just so the nurses aren't overwhelmed, but then you're also not having to limit the outreach to the support of the community that's now realized that this is something that's available to them?
Laura, it's a great question. A big part of going out of VNA is we give up all of those administrative duties. There was so little time, or not as much time as we wanted, where nurses were working with patients. They were working with Medicare, Medicaid, insurance companies. Now they'll work 100% of their time with patients. But to answer your question directly, it's very scalable. Once the infrastructure is set, the promotion is done, we finalize the services we can or may not be able to provide, and we're pushing that out to the public. Although for 27, we've got fiscal 27, we've got 3 nurses budgeted. That's easily scalable with the approval of town meeting and the FinCom on budgeting.
So will you be tracking like metrics and, utilization or volume or those kinds of things? So first of all, we can hear how it's going, because I think there's a lot of people interested in that. But then also, the town can respond to, any additional resources needed.
Right. I guess I have to say it'll be a good problem to have. So we want to be busy.
Yeah.
We're just getting going
not
here.
too
And I
busy.
just literally said to the town manager that we're fired up because we're busier what we're doing right now, implementing this, than we feel we were busier that before. And it's a good feeling. So yeah, I mean, maybe after we're 6 months in, God, maybe that we have to revisit that, but we're ready to take on what we can right now.
It's great.
And there's probably always going to be a town meeting somewhere because we had how many specials this year?
Special town meeting just for this.
Hopefully not.
And also remember, in terms of, when you ask these questions, I reflect on the fire service. There are other resources, both county and statewide. If we are overwhelmed on the public health aspect, immediately overwhelmed, some sort of outbreak, we wouldn't be able to handle that. Not every police officer, firefighter, and public health employee would be able to handle that, depending on what it is. And that's where we start reaching out to state resources. And they bring in strike teams. They bring in like a mass mobilization, right? If it gets to it, we could bring in, go back a little bit to COVID, but National Guard is setting up areas. That's where we come into play. That's what I feel like the fire service is very good at, right? Organizing that, running in a unified command, and then implement it and running it through all the way through to the end. So I don't want people nervous, like we're going to be overwhelmed. And there are plans in place already set up at the county and state level that if we need extra resources, whether it be MEMA or whoever else, we'll get them. Okay.
And just so everybody knows, we have moved. We're at 30 Freeman Street. So whether Mike likes it or not, we're right down the stairs from them. So yeah, we're already collaborating.
No, thank you. Mark?
Yes, thank you. Through you. So my question's on the FTEs. I know I asked earlier for the numbers, but I didn't want to cut line just in case people had questions on it. So the Director of Public Health, is that an FTE? That's one. So the administrator is gone. That is no more. But you have a budget for that for a line of $86,041.
Sorry. So the FTEs are 3. There's 3 of us nurses.
I need to know how these lines are broken down. The Director of Public Health is how many FTEs?
That's me. Okay.
So that's one. The administrator / nurse line.
2.
That's
second person.
no, just one employee.
Sorry, 1 FTE.
Okay.
Yep.
The wellness coordinator.
1.
Okay.
And then the third nurse, 1.
Okay. See, that's where I was getting before. So I was
sorry, I
getting
don't
3
know why that
nurses
says
and that's only 3. So the other ones were extra cash. I wanted to make sure we weren't having some extra money there. Thank you.
Okay.
Carolyn, if I could just interject for 1 second. I did send for the other meeting of confusion about FTEs and per line. I sent the org charts, and they're very recently updated. On every department, there's a summary table of all the FTEs for each department, and those tie right in with the budget.
I have a whole bunch of emails that I have to go and send out to all of you guys that I haven't had a chance to over the last day or so.
You just received it too, so.
Yeah. So
you can put that
I
on the
will forward
website
all
also.
those. Before I have a question, if you could explain what the role of the wellness coordinator will be in this department scheme.
Pardon me, I just put a piece of candy in my mouth. The wellness coordinator has been training for almost 2 years now to help prevent illnesses, both psychological and physical illnesses. First, he focused his efforts on police and fire. What we learned is police and firemen are very private. And we had several, if you will, clients, and they've done everything from training together to setting up a diet to financial services, because that's the source of a lot of stress for a lot of people. And it pays dividends. It's working out well. Working out so well that we're expanding it to town employees. That's under the collaborative, to all town employees and to all Stoughton residents, again, from birth to seniors. it's taking on many, many shapes, and it's outlined in the brochure as to what type of things the wellness coordinator is trained in doing. Now, I don't want to start a raging debate. I know it's been a source of debate since the day we hired the individual because of his last name. I think everybody at this table and all the nurses and HR will verify without disclosing HIPAA information about the many, many, many ways this individual has worked in support of physical and mental health of people, short of providing a professional service.
Right.
Thank you.
So, thank you. And I think we can just keep it on, focus on the position. It's not designed to be a clinical position that they're providing psychological services. It's designed to be more of a mentor type of thing. And referral, and whatever, on a variety of things as an outreach. Perhaps if someone needed a clinical service, it might help, but it's somebody, and they could do a lot of education. All right. Heidi?
I think you might have just answered my question, but I'm going to ask it anyways. So if my kid is sick, can I call and then have you guys see my kid and then write a note for school?
You can call us.
And we'll respond.
Yeah.
You'll probably just tell me to go to the doctor.
Probably.
Okay.
Depending upon, I mean, I can't diagnose. So, I mean, if you're talking about some mild symptoms, I'm not one to run to the doctor. I never took my kids to the doctor unless there was blood dripping out of their ears. So
That's
I'm
me.
probably not the one to ask that, because I'll say, give them some Tylenol and keep them home. But there will be no note writing though.
Yeah, they'll provide no notes.
Yeah, I know that's going to be a question. Thank you. Used to what?
Yeah.
I mean, all joking aside, I mean, if we get the flu cases that come through Maven, which is the DPH site, so if somebody was tested for flu or for COVID, I would see that. So if your child had flu and you wanted a note, I absolutely would be happy to do that. But I'd have to have proof that they had the flu or COVID.
Lauren?
Regarding the wellness position, I think it's an excellent position because firemen, policemen, and men in general don't really like to go to professionals right away. And if there's someone that they could just, talk with and discuss what's going on in their life, they'll be more assertive to do that. So that's what I think about that position.
Thank you. Are there any more questions from members of the committee? Cynthia, now I'll open it up to the public.
Cynthia Walsh, 1096 Park Street. To follow up on the previous speaker, any print material should be in Stoughton's top 3 languages: English, Portuguese, Haitian Creole. Anything on the website that should be in those 3 languages. When the program is up and running, Portuguese speakers, Haitian Creole speakers, there are many boys and girls at the high school that are bilingual, trilingual, quadrilingual. I know there's a Haitian American club. Those folks, those young folks, because of the way our high school and our middle school are run, are already familiar with technology and could do a kind of a panel show on SMAC for folks that speak other than English. Obviously, this is just in the infant stages. Everything sounds great, and we don't want to, as a couple of people have alluded, have them absolutely swamped. But it's important to use the folks that we have in our community as our resource people. And I'm sure high school kids who can speak Haitian Creole or Portuguese, along with an adult or a medical moderator. Let's face it, a lot of folks sit in front of the TV And that's a great way to let them know what's available. Thank you.
Thank you. Lisa, I understand you have a comment. If you could just come up, introduce yourself for the record.
Hi, Lisa Lyons, Precinct 2. So I'm deeply concerned about this entire department. So as stated earlier tonight, this entire department is taxpayer funded. Just on the basis of most people having health insurance, some people pay for health insurance, some people get their health insurance for free. Okay? There's health insurance, has referral services. Doctors ask all the questions that people are concerned about on this committee tonight, all get addressed at a doctor's office. As the fire chief has said earlier, this is confusing because people need to understand that 911 is still the emergency number. Okay? And I can't count the number of times I've heard the word confusing tonight. To that end, this is a startup program. So I think this department should wait and see what other towns do successfully to get to mobile integrated health. In the meantime, let's keep in mind that the VNA started out as a good idea too, was grant funded, and the taxpayers of this town has spent millions of dollars on the VNA that it was literally unsustainable to the point that we just eliminated the enterprise fund for that. And I also remember during my time on FinCom, people were attacking people who were pointing out the unsustainability of something. I heard the word scalable here. I just think we should slow the roll, to use a phrase, a little bit. This department does not have to be done now. And these three positions are able to find jobs because they're in the medical field. And we all said there's multiple different services, as the fire chief stated, at the state level. This seems more like a convenience for taxpayers. We have no metrics on the wellness officer position for 2 years now. We have no means to have a percentage of who we're going to help, but it's all on taxpayers' backs. It's a burden to the taxpayers who are already overburdened with taxes. So I would like, again, I understand everybody here has a good heart, to your point, Carolyn, for a previous conversation. I do get that. But at some point, we need to be frugal and understand the taxpayers would be fully funding this. And I think we should not approve this department. Thank you.
Madam Chair, just a point of information.
Mhm.
This reorganization is saving taxpayers $400,000 a year.
Thank you. Jonna?
Thank you. Through you, I wanted to ask, is this where I can discuss the grant position, or is it into the public health, or?
The
no?
grant position will come under the police department.
Never mind.
Thank you.
Thanks.
Any other comments on the public health nursing department? Natasha, if you want to come up, state your name, where you're from for the record.
Natasha, Precinct 2. Is this, like, first question is like yes or no answer. Does this department make money? Like, if I call and I have insurance?
No, there'll be no billing from this department.
Okay. Now, my second question is, I love the effort that's being made across the board, across all of our departments to find efficiencies and work together and find where we're overlapping. Does this department plan to work with our schools. I'm on the PTO of the South School, and we regularly engage with like the Angel Fund. And we know that there are certain things that teachers and principals and administration, they know about our student life, where resources can be provided, but maybe the connection between them and the resource that's in this room that so many people know about is not there. Is there going to be a concerted effort for cross-training to make sure that we're capturing the right audience?
Great question. Through the school committee and the superintendent, we absolutely want to touch every student where they are and make sure they're fully aware of what's available to them. Absolutely.
And then to everybody else's, which I think everybody else has talked about, I love that you brought up that there are so many grants that you guys have barely scratched the surface on. And the fact that I know that this program, to the other commenter, is scalable. I'd love to get an update when we start digging into that type of funding to see how much money we can get to counteract even that 400 that we see we're already spending.
Thank you.
All this stuff is.
No, thank you, unless you,
Statements have already been made. It's being stated to.
any other comments from the audience? Anyone on the public health nurse budget? Okay, not hearing any, we'll move on to the next part of it, which is the substance abuse prevention budget, right? And then we have articles.
Madam Chair, the department head isn't here at this time, I don't believe, but Donna is going to speak to it under the police budget.
Okay, thank you. So are we done with the items for the fire department budget right now?
Yes, unless you wanted to roll capital in, but if not, we can.
Oh, I'm going to do the capital, I'm going to do the articles now. I just want to know about the budget
yeah,
stuff.
Yes, as long as.
That's right. I'm going to do the fire department articles now.
Oh, okay.
So next we'll be do Article 20 of the, which is Article 20 of the annual town meeting, fire department capital. This is in the regular.
Article 16, special town meeting.
20. Article 20 in the annual town meeting warrant.
You mean Article 16?
That's why I'm confused.
Oh.
I know there are fire department capital names in both town meeting warrants, special and annual. The one in the annual is for fire department capital, looking for money for a fire truck. And if you could explain, it looks like the cost is $1,230,000.
Yes, and if the mayor, if the assistant chief can go over
Thank
that.
you.
Sure.
Madam Chair, through you, this is to replace our 20-year-old 2007 Pierce fire engine that has just under 300,000 miles and over 12,020 hours. The truck has served us well. It's currently in the shop and unfortunately has been in the shop on a regular basis. The life expectancy on these trucks is 20 years, and we've been fortunate to get 20 years out, but the time has come now to replace that truck. This fire engine, fortunately, Chief Carroll has built an excellent relationship with our partners at Allegiance Fire Truck Manufacturing, and they are our sales representative of Pierce Fire Trucks, and they're made in both Wisconsin and Florida. It is the sturdiest, most heavy-duty, durable engine. That's why we're able to get 20 years of service out of them. In the past, we've got only 10 and sometimes 15 years when we've chosen Laverne's, emergency ones. and other manufacturers of that like. Our goal is to get at least another 20 plus years. The highlights of this fire engine is it has a heavy duty Cummins diesel engine with the heavy duty transmission, also independent T-TAC that's proprietary to Pierce suspension that lasts quite longer than its competitors in the other apparatus fire service. And yes, we are requesting the cost for the specs of the trucks are 1.2 million, and I'm happy to take any questions that may have about this apparatus purchase.
Sure, thank you. Before I open it up to questions, what's the funding source?
Madam Chair, through you to the body, the funding source at this time, the $1,230,000 is anticipated to be from free cash.
Okay, thank you. I'll open it up to members of the committee about questions about the fire truck. And this is the only capital expense on this article. Is in this?
Oh, I'm sorry, different article.
Different article? Okay. I just want to
Correct.
make sure I'm, not missing anything.
Vice Chair Struck. Oh, Rebecca, my apologies. My apologies.
Thank you. Do you have a, when you buy a new fire truck, is there an estimated operating cost year over year to maintain the truck? And are you able to estimate that out?
Yes, typically within the 5 years, it relies heavily on biannual, what we call chassis services. And with privately owned vehicles, that would be known as oil, fluid change, filter changes, brakes, and tires. Typically within the first 5 years, that's what we see. As we get busier and busier, that 5 years is being compressed closer to 4 years, to where we will start to see required services of the suspension systems, which we do on a regular basis. Since we have 4 different generations of fire engines now, we fortunately have a suspension service right here in Brockton that we'll be able to directly tap into. And we typically, through the life of the truck, are able to maintain it and service it to where we're on the original engine, transmission, pump, the water pump for actually putting the water on the fire, and the drivetrain services. We do have one out of our 4 engines that is our only emergency one, and we will be replacing that with the Pierce engine. It's our only emergency one that we had to do a full engine rebuild on that. We've never had a full engine rebuild that we had to do on any of the past Pierce engines, and that's why we stay with the Pierce engines. I hope that.
Thank you. Are they built to, like you just said, we have one that's 20 years old.
We do.
Are they still building them to last 20 years, or is it like my washing machine that lasts for 4?
I absolutely understand where you're coming from there. We have had challenges with the early generation, what we call regeneration systems. These are the emission systems that have gone throughout not only the privately owned automobile industry, but the commercial trucking industry, and it has included fire apparatus. This truck that we're replacing does not have that regeneration system, and that is quite likely directly related to the fact that we have almost 300,000 miles on it, and we're still running the same engine. I don't believe we would get 300,000 miles out of any of these newer generation models due to the strict emissions. They end up, causing more wear and tear on the turbo services, and in general, the wear and tear on the engine cylinders themselves. So that has been a change and a challenge for us.
Okay,
it is getting better. The newer generations are better, but our older trucks that were the first generation with the emissions in them have required more maintenance than without.
Thank you. Mark?
Yes, thank you, through you. So this is replacing an old truck.
Correct.
Now, what's going to happen with the old truck?
Our goal is, as long as it's still serviceable, we will utilize it to service the town. Our two oldest trucks have the same engine, same transmission, same drivetrains. So we will keep it in service until it has a catastrophic failure, and then we could repurpose the parts to keep the next oldest
Right.
engine in service.
What's the
So-
timeline on getting the new truck?
That's a
It's gonna be
great, that's a
2 to
great,
4?
great question. Due to the close partnership that Chief Carroll has, Stoughton is considered like a preferred client status with the dealership that we use, and that's why we were able to expedite the build on the ladder truck that's currently on the assembly line being built. And what would normally take 3 to 5 years to build, the chief is already in direct discussions, and due to the fact that Stoughton is, stood by their word and fronted their Monday with bonding.
Right.
We get the trucks earlier than the 3 to 5 years, and we're hoping to get a new truck that's coming off the assembly line this year, but we can't bank on it, but those discussions are in place. Chief, feel free if you want to just confirm that.
Do these trucks take as long to make as the ladder truck that we voted on last year?
So this is a problem throughout the country, and if you've seen any, Congress had the actual manufacturers up in front of them quite a few months ago, but it's a problem. What I believe we've been able to do, and actually the town of Stoughton's been able to do, is we've become a real reliable customer. The reason why we were able to get a ladder truck is because we were ready to go, right? I also will remind people or point out to people if they haven't noticed, you may have seen a Hyannis engine or right now a Foxborough ladder truck in town. We are borrowing those. It's supply chain. It took us, these companies, I don't know what the problem is, but it took 3 weeks to get one particular screw. And the importance of that is it's putting these things out of service, and we want to be ready, operational, ready to respond. So we have a great partnership. There's going to be no frills. This is going to be a city engine type truck. It's shorter wheelbase, not all the cabinets and customary stuff that previous chiefs have. I think it's time to really let's get something up and running, get a good solid piece of equipment. And I also remind you to talk with this Foxborough program, we have now a new software. If any light goes on in that truck, they're notified right away. So they're seeing it before maybe even the person driving it. So we're trying to be preventive where they're on it at it early, and that's going to hopefully make them last a little bit longer and more durable.
Yeah. Next question was from somebody else, and they wanted to know the color of the truck, if it was going to be the orange and black.
Fire engine red, although we know there are a lot of fans of
the orange and black. I've heard a lot of.
Yeah, we're just not going to delay it. We're going to, if there's a truck that's red and ready to go, what it could.
The Stoughtonites do love the burnt orange ambulance. It's been a great hit, and we really felt great too. But this is red, fire engine red.
The last question I have is, how much is in the fire stabilization, the equipment one?
Yes, on the stabilization fund for the fire apparatus,
Yes.
the money that we have in there right now is $1,266,291.44. However, $1,150,000 belongs to the ladder truck that we voted in May.
Okay, cool. That's what I was double checking on. Thank you much.
You're welcome.
And Ian?
Thank you, Madam Chair. I think this question is through you to whoever can answer it. I feel like we're not leveraging the stabilization fund as much as we could. I mean, I think it's a fairly new fund, if I remember correctly. But yeah, I was just wondering, kind of, I guess, a plan, should we have put more money in for a project like this? I mean, we're fortunately in a position for where there's free cash to cover it, but this is exactly the kind of thing that I would expect to come out of a stabilization.
Well,
fund.
I suspect that there will be an additional deposit into that stabilization account for the ladder truck that we bought last year. That will probably be coming for us on April 1st when we do the hearings on all the funding all the stabilization articles that are in the warrant.
Yeah, I guess I was just thinking, because it feels like the stabilization fund is really only being leveraged for the ladder truck.
I
and
think that's because it's a new fund.
Okay.
Biz?
If I may, Madam Chair, through you to Ian and the body, the reason we're using free cash for this particular vehicle at the $1,230,000 is because they need to get this on order immediately, and they're hoping to get that in here within the next year. So by providing somewhat cash, then they can move as quickly as possible, so we no longer are borrowing vehicles from somebody else. And the fire apparatus stabilization fund, as you'll find going forward, we will continue to put money into that so we can start leveraging and stop the borrowing that we have been doing or reduce the amount of borrowing.
Great. Thank you.
You're welcome.
Heidi?
As I'm looking down the option descriptions, I see that some of them say that it's not required, but yet they're listed. So my question is, are we getting them? Are the items listed based on like generic needs, or are they state requirements? Or does this go back to, we're going to get the truck the first truck we can? Some of them look like they would be necessary, but others
Yes,
look like
all the necessary requirements are in the 90% solution that the chief just talked about several minutes ago in regards to going with the city stock heavy duty truck. So it would meet all federal and FPA and state requirements.
Thank you.
Any other questions from members of the committee? Open it up to members of the public. Any questions of the members of the public? Lisa and Natasha, if you want to come up and one at a time and ask your questions. I don't know if it's good or bad that I know your names, but
Well,
I agree.
so just a quick question for Elizabeth Zaletsky. Can you just repeat the amount that we already appropriated for, was it the ladder truck? That's already.
The ladder truck at your town meeting last year, you appropriated into the fire apparatus stabilization fund. I believe it was $1,150,000, which is approximately half of the purchase price. And during that time, we also did borrowing authorization that we will rescind once we have all the funding in place. We're going to rescind the borrowing authorization and pay cash for it.
Thank you. That's all I had.
Thank you.
Natasha, Precinct 2. My request is the same from the last meeting. I would love to see the various departments get together a list of fixed assets or capital items along with their useful life, so that this board can make informed decisions about what's needed today and what's going to be needed in 2 years to ensure that the plan can be compensated as we create these stabilization funds. Is there an effort to make sure?
So thank you for the question. Yes, to the chair, we have had a vehicle replacement policy that was accepted by not only the select board, but the finance committee since 2017, I believe. Yep. And we also have a 5-year capital plan where all these items, whether it was the ladder last year or in the engine, they all line up. We haven't, these are all been laid out for quite a few years now.
Do we, Mark, to Mark or the Tom, do we have a copy of that somewhere that we can upload to the website with the other stuff on the virtual table?
Yeah, we have a copy of the capital plan on the website. I can't tell you exactly what tab, but
Right.
I
I can
And
refer you to it.
yeah, and if you can, like, if we have a copy that you can email me,
Absolutely.
but I think if we throw that up on the town meeting table too, virtual
Right.
table, that would help.
We can give you a copy of that, and just to update, we did receive a big package from the schools with their capital plan.
Mhm.
They're gonna reduce it into our format.
Okay,
So it's, their stuff is not in the capital plan.
right.
just
If
yet.
you could like also forward me whatever they sent you, just for, even for our purposes right now, so that people can see that it's been done, and we can
not a
understand you all want it in one format. It makes it easier for all of us.
Right.
Any other question? Do you have other questions? All right.
Just one follow-up question. When is the next vehicle expected to be needed, and is the stabilization fund set up to be able to foot the bill?
On the stabilization.
Is that in
fund.
regards to 2028? So we're talking about next year?
No, I think the question is, we have two people trying to answer. I think your question is that you want to know when the next truck that we have to buy is coming.
Yes, you said the list, there was some existing list.
So when are we planning, we have a truck this year. When's our next one that we plan to see before us?
So.
Do you want us to go through?
So that will be an ambulance for FY 28 town meeting, or FY 20, when we're doing our fiscal year 28 budget. And
No, that would be next year.
that'll be next year. Yep.
So next year we'll get an ambulance coming for us.
And
All right.
I apologize, but the cost, I understand the impact. I really do.
No. And they get a lot of use, so we understand that. And, face it, we all want them to come and not break down when they're on their way to our houses. Thank you. All right. Any other questions or comments on Article 20 about the fire truck? All right. Next, we will go to the special town meeting, Article 16, Fire Department Capital, which, for those of you that do not have the warrant in front of you, is to purchase life safety equipment for the fire department in the amount of $450,000. And I presume this is coming from free cash. Thank you.
So real quick, this is the firefighting turnout gear that you see. We protects us and protects the men and women of the department during a lot of hazardous situations, not just fires. The importance of this, and this is why I come to the town, because sometimes I do try to look forward, is in 2027, January 2027, the state the governor of the state has built into law that no PFAS or PFAS-free firefighting gear is to be purchased across state lines. Before those numbers really kick up as far as price, we have built that into our layout here and working with the vendor. But when that hits, I've been told, and from other chiefs, that price is going to skyrocket, because the minute we cannot accept anything with PFAS in it, it's going to be an upcharge. I've been able to get the best stuff, which is really PFAS free, but it's before it's hitting that market and those prices ramp up. And it was always built into our capital plan. So that's the importance of it. And it's only good in all the gear. It's told to be replaced every 10 years. And this kind of fits into that timeline.
Thank you. Questions, members of the committee? Laura, then Mark.
I don't know a lot about PFAS in equipment, but I'm assuming that the reason you don't want PFAS in the equipment is for some health and safety reason. So why is excessive amounts or unacceptable amounts to the fire department? Why is there still so much PFAS in the
It's just
equipment?
plastics in the Teflon and the inner liner, especially the stitching. It's a Teflon type stitching because this gear, It's so temperatures, it starts to fail at, I believe, above 700 to 1200 degrees, but also working in that, they have done studies that it comes back to occupational cancer.
Mhm.
And so, and I understand the need for it, for them to pull it out. It's really difficult, but at the same time, we're in a toxic environment usually, and all the toxins, but I digress. So it's occupational cancer related to their gear and some of the studies have found. So our goal is to get that PFAS free as much as it can be. But my really push, and it does play out for us, but it is to try to get this before it spikes.
Yeah, and I understand PFAS association with cancer. I guess my question is, for fire equipment, is there going to be some sort of acceptable level that's then mandated, so you don't have to buy special equipment? You would just buy
Yeah,
fire
that-
equipment, it would all be good with the PFAS.
I'll reserve my own thing
Okay.
there. I think we got out in front of it before research and development could catch up to it.
Okay.
But
All
I'll
right.
leave it there.
So you're ahead of the
Challenging
curve.
To make the gear durable without the PFAS. They
So
are,
eventually
as
this
the
would be
chief says,
something.
they are developing that technology to do it. Unfortunately, it's far more expensive.
Got it.
But
And it's not perfected.
they've perfected it, unfortunately,
At a
at a
cost.
cost.
Okay.
All right. Well,
And hopefully that will, over time, that cost will come down, but.
Got it. Thank you.
Mark?
Yes, thank you. Through all the stuff, I couldn't figure out the exact amount of PPE that you're getting. Like how many jackets, how many pants, how many?
Sorry, that will cover a set for every firefighter on the department. So it's 67 sets. Is that correct? 66 sets of gear.
Are we 66 sets?
Yep, that will cover all members. Yep.
Okay. And I know you have 66 on the thing, but are you gonna have like an extra set or two just in case somebody wrecked?
So what they do is every 5 years, they replace, so that other gear becomes their backup set.
Okay.
And that's kind of how we've been doing it. And so that and it's used a lot is that second set of gear.
Okay. Thank you.
Thank you. Any other committee members have any questions on this article? Any members of the audience have any questions on this article? Not seeing any. I think we will move along. I believe we have covered everything for your department. Thank you, guys. You have been here for a
Thank
couple
you,
of hours and all
everybody.
your questions.
Thank you. I appreciate it. And that email, I probably, I
Oh,
didn't
no, it's
realize
great.
how tiresome it would be, but.
Oh,
I
no,
appreciate
it was great.
Okay. Thank you. Thank you
Yeah.
again, everybody.
Biz, can we have the number, please?
Of course you can. Police Department starts on page 28 in the packet from February 26, page 28.
I just have to say, I love that Biz says the numbers. It reminds me of synagogue when the rabbi tells you what page number you're on, nobody knows. So you wait for the rabbi to tell you. That's what Biz does.
Well, I'd like to say I feel important tonight.
Biz, you are always important.
I'll try.
So hi, Chief, whenever you guys are ready.
I'm ready. Good evening, Chief Donna McNamara and Deputy Chief James O'Connor, who's responsible for the administrative portion of the department. Just like to start with, I think most of you saw the town meeting presentation that we did last week regarding all our hiring. That's a big positive that we've been able to accomplish with 14 hires in 1 year. I won't get into all of that, obviously, it's a little late, but just to commend what our department has done over the last few years with all the shortages and the amount of level service and exceeded service that they have done. And we are looking forward to the even more proactive work that we'll be able to do now that we have all those vacancies filled. Additionally, there's been some talk about a social worker, and I will let Deputy Chief O'Connor talk a little bit about that. We have a co-response program through a grant. None of it is in my budget. You will not see any of that because it's all through a grant. And that will be an embedded social worker that is in the Stoughton Police Department that will go on co-responses. So if any questions that come up on that, Deputy Chief will talk about it. We have also invested, and you'll see in our budget, we have invested in not only the professional development at every level, significantly at the supervisory level in the department, and you'll see some of that in our budget increases, as well as technology upgrades for our budget. So I look forward to any questions you may have, and I can go through it all if you would like, but you'll see on the notes that many of the increases are contractual or employment agreements for the department.
All right. I'm going to open it up to members of the committee about questions on the budget. Becca, then Jonna.
Thank you. I have a question on, I know it's contractual, but on the education incentive pay, that's a separate line item. So can you just talk about how that works?
Certainly. So that is contractual through the patrol officers, superior officers' contracts. And depending on what their education level is, depends on what they get paid. And that's, for years, has always been a separate item because they get paid in a one lump sum for that. And so it's always been its own line item.
Okay, so it's a lump sum on like a yearly.
Correct.
Like it's just one, like a bonus basically.
First pay period of July.
Okay. All right. Thank you.
Jonna?
Thank you, through you, Madam Chair. When does the grant run out?
Which grant are you talking about?
I'm sorry, for the new job.
It's a through you, Madam Chair, it's a co-response clinician, and it's a year-by-year grant, and that's why we're trying to get the up and running.
Okay, and is the grant funded position coming from the budget or outside the budget? Does it touch the budget?
Does not touch the budget, it is a grant to the Department of Mental Health.
Thank you very much.
Any other questions from members of the committee on the police department budget? Arnie?
Good evening.
Good evening.
This is just a clarification for myself. What is a specialist stipend?
Specialist stipend. So we have a number of specialist positions in the department. So the detective is a specialist stipend because their rank is technically a patrol officer and they get a stipend for being a detective. So we have some detective stipends, SRO stipends. Majority of them are in the patrol officer division.
Thank you.
You're welcome.
Any other questions from members of the committee? Oh, quiet. I'm going to open it up to members of the audience. Any questions on the police department budget? All right. Oh, sorry, Heidi.
It's like, I'm going back to the overtime pay because you got 14 new hires. So I kind of expected that this overtime pay number would go down, and it went down, you know, some, but not, I would say, considerably. Page 28, midway down.
Through you, Madam Chair, the overtime budget, through discussion with the budget team and the town manager, we left that with some of the contractual increases at this time. Again, should be fully staffed. But as I have discussed in many meetings, we are looking to retain our employees that we send through the academy, but we also have to prepare that we need extra people on for different crises that may happen or overtimes, just the blizzard that we had last week.
Madam Chair, one other item to Heidi through you is we also had a situation where many of our ethnic celebrations annually, like the Portuguese festivals, were closing down because they couldn't afford details. And the select board made a policy decision that we would reduce or eliminate the cost of those details to those ethnic celebrations because certainly we don't want to lose them. It's a key part of the fabric in Stoughton. So a significant part of that is for those celebrations. Another portion of that are all the 300th celebrations that are sponsored by the town that we don't charge the town. We're running it through the fire department, the police department. And that we need a year to test what that's going to be in terms of impact on the bottom line. So that's why it's budgeted in a similar way. We do expect in years out, the increasing headcount should have a profound downward effect on overtime.
Thank you so much.
Becca, I believe you have a question
So
or two.
I have two questions from Joel Wolk, who's not here tonight. His first question is, the total personnel is 73 FTEs. Will the department be able to fill all of its positions for FY27?
Yes.
Okay. Second question, line item 511135, town details. He says, I thought this was covered in other town budgets like DPW.
DPW does pay for their own details. This is town clerks, elections, as such.
Perfect. Thank you.
You're welcome.
Joel, that's the easiest you've ever been on.
He's saving it up. He's waiting for your budget.
Yes.
Arnie?
This is just again, curiosity question. We provide police details for construction. I'll see 2 or 3 policemen there. And is this a state requirement, or can we put in flag people there?
That is a union contract, and those are state flaggers are for state roads. And if they're not requiring it on the state road and they're asking us to provide the service for certain jobs, then it's our police officers or the communities that we reach out to around us. And again, that is not a cost that comes out of my budget.
Okay.
That is passed on to the utilities.
Thank you for the clarification.
You're welcome.
Jonna?
Through you, Carolyn, just a comment. Now that you've got all these new hires, is there going to be someone maybe that is going to help out with the firearm, renewals?
We have no backlog. We have had a task force working on that with the new licensed lieutenant, and we do not have a backlog.
Congratulations. Good job.
She's
Thank
done a
you,
great
thank
job.
you, thank you.
All right. Any other questions from anyone? All right, not seeing any, we will move on to the next budget that's under the police departments, which I believe is substance abuse prevention.
And substance abuse and prevention is on page 57, please.
It is, but it hasn't been moved in yet. I think that'll happen next year. I asked that earlier. Page 57 of the budget.
Okay, this budget, if I may, through you, madam. 1 FTE, and the increase is 2.48%, and that's contractual from the SPAEA union.
Thank you. Any questions from members of the committee? Becca?
The contract service, is that a person from AmeriCorps?
Correct.
Okay. Oh, awesome.
Any other questions from members of the committee on this budget? And the bottom line is, can you just give me the bottom line of the budget?
2.48%?
No, I'm the actual amount, just for people listening, so that they
Okay.
understand.
102,835.
Thank you. Any questions from members of the audience on the substance abuse prevention budget? All right, not seeing any. We will move on to the next department, which are crossing guards.
Crossing guards are located on page 31.
Through you, Madam Chair, the increase for this budget is 2.47%. The FTEs, it considers it 18, but they're part-time positions. They work morning and afternoon, split days. It's very confusing. If you really have a lot of questions, the deputy chief will answer those because he takes care of that.
Thank you. Becca?
I just have a comment. Mr. Thomas is amazing. So I just have to say, when my kid was in middle school, he did not give any of the holiday, like he didn't give holiday gifts to anybody, but he did to Mr. Thomas, the crossing guard. It's the only one. So he's amazing. They're all great. Like I see the one at the Hanson, but I see Mr. Thomas twice because he's at the OMS and he's at the South. And so I tend to drive that way, but he's amazing.
Thank you. I'll pass that along to him.
Okay.
Mark?
Are you currently fully staffed on all crossing guards?
I am not, no.
You want a job?
No. What was the question? How many are you short currently?
I believe I'm down about 4.
And you have ads out for that and all that?
It stays posted on the town website. I get applications, but not successful.
Okay, thank you.
What are the qualifications to be a crossing guard?
Basically, you have to be able to stand for 2 hours, have a driver's license to get to your position, and virtually no criminal record.
Thank you. Just curious.
Yep.
All right. Any other questions from members of the committee on this budget? Any questions from members of the audience on this budget? Want to come on up, Lisa?
So it's Lisa Lyons, Precinct 2. It's actually on the police budget itself. I understand, hi, Chief. So I understand on the budget on overtime, the rationale. Does that come back in if it doesn't all get used into the general fund? What does it become, free cash? Just for the people watching.
Yes.
I can take that. What
Thank
comes
you.
back to free cash is the net of the overall budget, not just a single line item.
Right. So if there's a net in the overtime, if there's a net in the department budget at the end of the year, money left over, that goes into free cash.
Correct. It's part of the calculation.
Right. Ian?
Thank you, Madam Chair. It's somewhat tangentially related. I don't know if there's any effort to do any kind of crosswalk enforcement. I run through the center of town on a daily basis, and even I press the light, I wear high vis, and I'm still taking my life into my hand. And so it's like the crosswalks are great, but I mean, to the point, I don't think we have nearly enough. And I see so many cars that are just clueless about crosswalks in general. So, because just thinking it as an opportunity to both educate and possibly even bring in some revenue.
Yes, there is. We get money from the state to do certain types of traffic enforcement. And at least one of the targeted things is crosswalk enforcement.
Thank you.
You can go sit in the square and watch for all the people that don't stop at the crosswalk. All right, any other comments on the crossing guard budget? Any other comments? Any in the audience? All right, not hearing any, we will move on to the next item on the budget item, which is animal control.
Page 38, please.
Okay, this budget is an increase of 3.18% and 1 FTE on the entire budget, 1 animal control officer, full-time position.
Thank you. I'll open it up to members of the committee. Any questions on the animal control budget? Mark?
Yes, through you. Mine was on the telephone. Why the increase so much on the telephone when it's only, I'm guessing, 1 cell phone and 1 landline?
That is the hard line down at, and it's not within our building, it's down at the shelter. And the cell phone is under the cost in the police department that goes to the position. It's just what we've been getting cost for.
So it's $2,000 for 1 cell phone and 1 landline?
1 landline.
1 landline and 1 cell phone is $2,000.
No, I think it's just 1 landline. Is that what you're saying?
That is the bills that we've been getting from the phone line and for the shelter. The cell phone
is
separate.
under the police department.
So $2,000 just for 1 phone?
Yes, sir.
That's kind of a little crazy, is it not? No.
No,
just
it's
separate
down
by
at,
itself.
It's a separate
soccer
building,
fields, it's a
everything's
shelter.
separated.
Just 1 phone. Why is it $2,000?
I will check on that for you, Mr.
Thank you,
Stoughton.
Don. Thank you, Chief. Tom, did you have any? Thank you. All right, any other questions on this?
We will look into that.
Yeah.
Thank you. Any questions from anyone in the audience on this? Cynthia?
Is the animal control officer still the same woman?
Yes.
I don't think the general public knows that besides being the dog catcher, also picking up dead animals on the street, things like that, she does barn inspections once a year. Those of us who have livestock, she comes and looks at the animals, looks at their shelters, makes recommendations because of the increase in our goat herd. Last year, she recommended a 2nd shelter, which we promptly went out and bought. So it isn't just the traditional cartoon dog catcher role. It's any animal. If you've got a raccoon in your house, that's who you call to get rid of it. Not that I've had that happen, but I do know she's very conscientious about her barn inspections, and that's important. Many people purchase livestock and really don't know what they're doing, and without someone coming once a year and kind of looking at the condition of the animals, although she's not a veterinarian, and looking at the condition of their shelters, it helps protect the animals, and that's part of animal control.
Thank you. Arnie?
If you wouldn't mind me making a suggestion, did I overhear you said at the animal shelter it's an internet line?
That's what we're thinking the issue on the cost could be, but we'll follow up on that so you know.
I've had Magic Jack for approximately over 10 years, and it went up to a price of $50 per year.
Okay.
That would be a nice savings.
So we'll look into that.
Okay.
Absolutely.
Any other questions from members of the audience? Members of the committee? All right, we can move off of the animal control budget to the civilian dispatchers budget, which I believe is the last budget under you, right?
Yes, that is correct.
Civilian dispatches is on page 32.
So under this budget, there is one FTE and it is an increase of 3%, and currently that position is vacant.
Okay, thank you. Questions from members of the committee? Becca?
So is this vacant FTE position in Holbrook, is it? No.
No, so when we left and moved the dispatchers over to Holbrook, we kept one position, and it was to stay in the police station. And that was through an agreement with the previous union. And we kept this budget open as a result of, in the future, when we have to fund money that goes over to Holbrook for the dispatch. That's why we left this budget open. So we left that position in this budget to keep a budget for it.
Oh, so just to rephrase, the money's in this budget. If the position stays vacant in FY27, do we have to give this money over to Holbrook, or does the money stay with us and go back in?
That money stays with us. It's our budget.
To the general fund.
To the general fund. Perfect, thank you.
I don't expect it to stay open for the next year.
I do.
We'll say any possible savings.
We'll stay tuned for next year to find out the result.
Madam Chair, just a point of information, in 28, we start paying 25% of that $1 million a year we saved for the dispatchers.
Okay.
It was 3.5 years of paying nothing, and then we paid 25% a year for 4 years.
Okay, thank you. Questions, other questions from members of the committee? Any questions from members of the audience? $2028 is when we have to start paying the 25%, right? Just so that it's, people pick it up. Thank you. Okay. Not hearing any other people wanting to speak on the civilian dispatches. We have finished the budget parts for tonight, and we will move. There are 2 articles in the special town meeting that regard the police department. We have Article 15, which is Police Department Capital, and that's where we will go now. And for people watching, the items that are listed for purchase in the Police Department Capital article include 3 marked cruisers for the cost of $265,000, a first responder drone and software for the cost of $110,000, flock safety software, the amount of $60,000, and taser replacements, 10 units for $30,000 for a
Excuse me,
total
could you tell us the page, please?
of the warrant. Pick one. It's in your warrant. All right, and it appears the funding source is entirely free cash on this one. Heidi?
Do we already have drones?
No, we do not. This is the beginning of our program that we're trying to develop. We have pilots already trained in the department.
That was my next question. Thank you. So do I get another one? What is flock safety software? Is that, I'm not even going to guess.
I'm going to let Deputy Chief O'Connor, because he's developed that program. We have a grant for that, so he'll speak on that matter.
Okay.
So Flock Safety is an LPR license plate reader program that allows us to put license plate readers in various points that we feel necessary. And it helps us be able to track down criminal vehicles that we're searching for.
So they'll
So-
be in various places in town?
Yes.
Okay.
So like if you're getting a hit and run and the car takes off and you get, hey, it was a black Honda Civic, we can search for that.
And then my final question, how long does a taser last?
Depends.
Depends on how much you use it.
No. Well, it's like taser replacement. So we're replacing tasers, right?
Only 10 units.
Yeah, but like, so do they last like 10 years? Do they last 5
They've
years?
lasted about between 5 and 6 years is what
Or is
we've
it
been
like
getting out
every
of these
20
units.
uses?
So we first got them in 2012, and this will be the third time that we haven't completely outfitted the entire department. We're slowly starting to replace some of them instead of a bulk purchase of 85 units. We're trying to replace them slowly and certainly get a smaller amount because the cost has gone through the roof.
Okay, thank you.
Becca?
For the Flock software, I know there are a lot of issues with data and security for it. So do you guys have a plan for that? And where will the data be stored and how long will the data be stored?
So we have a whole policy on the use of it. We also have some mass laws that are required on the sharing aspect, but it's held for 30 days and then it drops. Unless we save it, a certain thing, like say it was a homicide and I tracked that car, I could save that data because it's evidence. But anything else that gets caught up in it gets deleted after 30 days.
I know, I'm sure we've all seen posts on Facebook. There was somebody swiped my card. Did anybody see that? Will civilians have access to this information? Or only if they contact?
Only if they contact the police department. We will have users that will be able to investigate that. So it can search by plate or vehicle description. And it can go down to, you can just put in pickup truck and it'll find whatever pickup trucks are in the area at the time. And you can put time frames on it and be done with it.
Okay. Thanks.
Mark?
Thank you. A couple of mine have been answered. One is, will this system be used to send out remote tickets
Not at all.
now or in the future?
Not at all.
And that's on record.
That's on record. It's not video. It's snapshots.
Yeah, you can snapshot somebody
So-
running through a red light. That's all. I'm just putting it out there. That's all.
A snapshot of a car in an intersection doesn't show the actual violation, so it's not going to be used for that.
I'm just.
Can they use it for crosswalk violations in the square?
That's right.
No.
My other question is on the annual recurring of 24,000. Are we gonna have a bill every year for 24,000? Or and like this
Are you talking
initial?
about the flock still?
Yes, on Flock, sorry.
Yes.
So every year there'll be a $24,000 bill. Will that now go into the budget or will that be a capital expense?
It should be in the budget, I would think.
We want to put that into the budget going forward, so we're getting the capital to get it all up and running and then build it into the budget, yes.
Okay, so it will be built
Yes.
into the budget then. Thank you.
Sorry,
Becca?
going back to the data storage again, even though it's only saved for 30 days, will it be saved on Flock servers or on the town servers?
It gets deleted after 30 days from anywhere it could possibly be.
But within those 30 days, where is the
Oh,
data saved?
It's on Flock.
It is on Flock system.
Yes. They do
Okay.
the storage for us as well.
Okay. And then as, a $24,000 renewal, companies can put, and depending if we're ordering this under a statewide contract or, directly through Flock, are you looking to do like a 5-year renewal where it keeps the cost down, or 24,000 will turn into 30,000, will turn into 35,000 because that's what they do every single year? Are you guys in talks with them about that?
So I have not specifically discussed that, but it's per camera.
Biz has something to add.
We can only do renewals for 3 years. It can't be for 5 years. And when we go ahead and we're negotiating going forward, I'm sure we'll have a good 3-year price as the police chief and deputy work very hard to control their costs.
Thank you. I have a question about the Flock software. I was asked to ask this by somebody. There's talk like, does this software, anything on this software get communicated to ICE?
No, it is against mass law for that.
Thank you. That was the question I was asked to ask. Ian?
Thank you, Madam Chair. Just for comparison, how much do we pay per handgun for the police?
It's about $2,000 total for all the equipment.
Okay, just because my math is saying 3,000 per taser seems, high, and I'm not certainly advocating, one or the other. I'm just trying to kind of get a sense of, a ballpark for, one piece of equipment. $3,000 is, sounds like a lot of money, and I know you've addressed it saying it's increased quite a bit.
How do I say this nicely? They cornered the market on it, so Axon is the #1 firm and so yes, they are very expensive. So that's why we've tried to do it in less increments instead of I won't even tell you the quote that I got to replace everybody in the department. It was very expensive.
Thank you.
Any other questions from members of the committee? Any questions or comments from members of the audience? Cynthia, then Lisa.
Cynthia Walsh, 1096 Park Street. Will the drone be able to sense heat if you were looking for a lost child or a person with dementia in the woods?
It has a night vision, not necessarily being able to detect heat.
So night vision, but not heat sensing.
Oh, I believe, actually, sorry, I've been corrected. The drone that we've been looking at does have the heat detection option on it.
Well, I suggest that. We have a number of folks in Stoughton on the nonverbal spectrum and even if officers were in the forest yelling their name, they would not respond. So that if it sensed heat, the same with anyone who is suffering from some form of dementia, they may actually be hiding because they think something, some monster's after them. So it's important that we be able to locate these folks and get them some help. Folks with dementia and folks on the nonverbal end of the spectrum of autism tend to go toward water. There's a lot of water in Stoughton. Many of them, once they get in the water, drown. And you've probably seen this on television where 5- and 6-year-olds have wandered out of the yard and drowned. Not in Stoughton. And so that's important. And also about the, what was the other thing, Cynthia? Oh, the software. I know folks are concerned about privacy and they're concerned about maybe this will be used against them, blah, blah, blah. But when something happens, like someone picks up a child and just takes off, sometimes there's custodial disputes. This is vital information. Also, in a very recent high-profile kidnapping, I know we like to think Stoughton is Mayberry. This stuff doesn't happen here. But the bad news is it happens everywhere. And the more tools we give our police and fire, the safer we'll all be.
Thank you, Cynthia.
Thank you. Lisa?
Hi. Just Lisa Lyons, Precinct 2. Just a real quick question on the drones. Will they be will citizens in Stoughton be able to distinguish that it is a police officer drone versus a citizen drone? How will this be distinguishable so that people don't feel like they have a peeping Tom around and it's a police operating it?
I don't, through you, Madam Chair, I don't think it's large enough for you to be able to see it in the height that it is in the air so that you can see anything to distinguish it.
You and I. Oh, sorry, Mark and then Becca.
Chief, would you say it's basically like the drones that are used at the 4th of July for the most part?
Yes, we've had them at the 4th of July events, and we've had multiple drones in the air throughout that event, yes, correct. But they have been not our property, they are mutual aid from other communities, and that is become more of a demand, so that is the reason why we're trying to do our own program within the department, because it is harder to get the mutual aid drones.
Right, but it's basically the same ones.
Correct.
Has there been any talk about trying to figure out how to make them distinguishable?
I'd have to look into that one.
Thank you.
Yes.
If you could. Becca?
While I'm talking about technology, for the data then from drones, because you can use it in real time or you can actually record. Where does, if you're using it to record data, where is that data going to live?
That would be with us, because it's going to be our property.
So it sits on our servers?
On our server.
Okay, and then again, will that data be wiped after 30 days so you're not wasting the space, or unless it's part of investigation?
If it's part of an investigation, we would be holding on to that. But if, I'll use the example that Ms. Walsh gave, we had a missing child, we wouldn't be keeping that after we located the child.
Okay, thank you.
Heidi?
Would you, piggybacking on that question, would you keep any of that data for teaching purposes or for training purposes, or is there's something already out there that already exists?
If there is something that we can learn from it, I mean, we do after actions on any major critical incident that we have. So we do train off of that, and it wouldn't be something we keep for a long period of time and need to hold on to take space in the data.
Any other questions or comments from anyone? Come on up.
Natasha, Precinct 2. Well, I personally don't have ICE concerns. I do obviously need to have neighbor concerns. How can I be sure when it comes to the flock system that a neighbor or somebody that's just a disgruntled person won't see my vehicle driving by and come and tell you guys I hit them and now my personal information is being searched for? Will there be like a process? You know, are you going to keep that information private? What's going to happen?
So as with any investigation, that's exactly what it would be, to determine if, one, a crime did occur, what that crime was, and what evidence there is. So like you use the example of maybe like a hit and run. We'd be looking for evidence physically on both vehicles, probably before we even search the flock system for something like that. You know what I mean? So it just depends on what the nature of the investigation brings.
Okay, no problem. And I just have one follow-up question. You know, we all are aware of different police forces going through different things around us. This does open us up to, you know, how are we making sure that members of our police force are monitored when they have the ability to access this personal information, to make sure that that access is legitimate and monitored?
So there are criteria that needs to be filled out documenting when, why, and what you're searching for. And there's also part of the software in the administrative portion to do audits. And I am planning on doing monthly audits on that data to help alleviate the general public concerns that could be happening. And if there is a problem, to deal with it before it becomes a major problem.
Thank you. Any other questions or comments on this article, on the various items, the capital items? All right, not hearing any, we're going to move on to the, believe it is the last article of the evening, which is Article 21 of the special town meeting for, which is a police station feasibility study.
Madam Chair, I'm going to turn this over to Mark in just a second to talk about it. Mark and I have been working together on this. We have concluded that the Armory is the best location for an upgraded police station. And so Mark will speak about the feasibility study and what it'll look like. But we know that that footprint of that building is 2,500 square feet larger than our current police station. But the real restriction at the current police station is parking. And no revitalization of the current building or replacement of it with a new building is going to solve the parking problem. And we're seeing that parking problem now that we've got 14 new offices. We knew it would happen. It's happening now. So I'm going to turn it over to Mark. And before I do so, I'll tell you that we met with the Massachusetts State Inspector General several weeks ago and showed him what we did at the community center. And we proposed a new approach to building municipal buildings that doesn't bypass but minimizes the bureaucratic input from DCAM, from state procurement laws. And we're talking to them about a pilot program where we can build a new building for just a little more than half of what the estimates we got for to replace that building by using these new standard operating procedures. So that's why we've got it on the town meeting warrant. But I'm going to like to turn it over to Mark to explain what exactly it is we're trying to pull off here.
Thanks, Tom. Appreciate it. Yeah, I'll keep it simple. I'm sure Donna and Jimmy can answer the program questions if you have any. But essentially, at last town meeting, we had an article for a feasibility study to look at the police station site. A lot of discussion about it. At the time, the idea was, can we put an addition on that building and or renovate all the building, part of the building to address their future needs. So they went through a long, extensive process this last year, programming what they need for the future, what they need now, and they mapped out a design building. The other part of it was the site, which I've always talked about and explained my concerns. I didn't know for sure because we didn't go through this process yet. But it did result in a lack of parking spaces. Essentially, the parking spaces are designed for today's standards, not for future growth. And it's a very, very tight site. The building got larger than expected because of architectural reasons and things of that nature. But the site is just very constricted. You got parking spaces right up to the property lines, and there's just nowhere to go. And that's also utilizing the other parking lot on the side of the police station. So it's not just the existing police station parking lot, it's the other parking lot. I believe in 2020, when we completed the joint public safety building study, if you remember, we're going to do a joint fire and police station building. It yielded, for future planning purposes, 75 police station parking spaces needed. The site over here, correct me if I'm wrong, if I'm off by a parking space or two, I apologize, but I believe it's 55 parking spaces they were able to get, which is tight even by today's standards. If you think about it, I think 10 of those parking spaces are for the public, roughly what they have now. They have vehicles, existing police vehicles who park in some of those spaces. They have their staff and employees that park in those spaces. It's just very tight. So essentially, we went through the motions. They also looked at a brand new building on that site. That's what architects do. They looked at a brand new building as if we were going to demo the entire building across the street and put a new building. Believe it or not, That's actually the most cost efficient option, although that would probably not go over too well with the public. That would be about a $45 million building if we're going to demo the building across the street and put a new one, versus a $50 million addition renovation of the existing police station. So in our mind, we've talked about
Excuse
it.
me, just,
Yep.
I just want to,
Yeah.
so it would have been, you're saying it'd be 45 million to demo and build a new one over there.
Yeah.
But it would be 50 million to do the renovation.
It's, I'm sorry, correct me wrong. It's 55 million. It's more, the crux of what I'm saying, it's more. Yeah.
Well, no, I know
Yeah.
that's also happened on other projects.
Because you
and it's
got to bring,
counterintuitive.
so it's actually more expensive to bring parts of the building up to code and architecturally than it is to actually just wipe it down and build a new one. And that's just, and I'm sure there's a lot more details behind that, but essentially, if I was going
No,
to
I have no
summarize
problem
it,
believing it.
that's the reason for it. I lost my train of thought. Thanks, Carolyn. I was going good until you.
Sorry, hey, I gotta do something while
but
I'm up here.
I think I got most of what I wanted out. But essentially,
I guess so. How did you wind up at the armory? Maybe you could explain.
Okay,
how.
so that's right. Yes, that was part one. So part one was what we completed. That resulted in, we believe that resulted in a not a feasible project. So we have to keep on looking for other options to explore to get a police station. And did you want to say something, Tom? Okay, I thought you just wanted to say something. Okay, all right. So the other options we could think of, exactly what we looked at when we were doing the joint public safety building. The armory was one site, town-owned sites. We don't want to start looking for sites again. That was not a fun process to go through. And then the Washington Street site, where the DPW has like the storage of their materials and things of that nature. Both those sites were looked at for the joint public safety buildings. We had a lot of information, a lot of good data on those sites. Even looking at those sites, this article is written up looking at those two sites. The Washington Street's pretty easy. It's a new building. It's pretty much a vacant piece of property with DPW storage on it. You just take the new building they designed here and you put it on that piece of property. So most of the cost of that feasibility study is not related to that. Where the cost comes into play from a feasibility standpoint is going to the armory. Now there'll be two options at the armory, which the more and more we talk about it, it's actually seeming very intriguing. So one option would be looking at the existing building. We've been there recently. Tom never went there up until about 2 months ago. We brought Tom in there. The shell of the building is very solid. The roof, there's not a lot of big leaks in the middle part. It's the outside buildings that have problems. But it's a brick building. It's solid. It was an armory, so the foundation and the slab's good. So option one would be looking at renovating that building to house. The entire department. Now that could happen in phases, right? It could happen in phases. We're thinking phase one would be possibly to just move the command staff over there and have the patrol situation still over here. So, but if we did that, it wouldn't be a long-term solution. It would be more of a short-term solution. But with the understanding that we would design the entire building for long-term, so the entire staff would be over there. That would open up this building across the street in its entirety for either if we had our own use or open up to the private sector and get more tax dollars on the tax rolls to help maybe offset our payments for the armory. If we did phase one where we just said, okay, command staff over there, the entire building would be designed for the future of an entire police station being there. So there's been a lot of ideas. I've literally mapped out this building here, right? This room, and it can drop into the middle of the armory with a lot more space on each side of it. And you could imagine just command staff around the perimeter of the building with even more room. You could also put a mezzanine in that building. It's very high ceilings. So we could design a mezzanine with additional office space in locations above that. So that building has a lot of options within the building. But the good thing is the existing outbuildings are actually, the roofs are leaking and all that, but the walls are solid. Windows can be replaced, roofs can be rebuilt. And there's a lot of room even for additional expansion onto the building where we can actually utilize the existing, there's no other site where you could actually utilize for a firing station, excuse me. That has a firing station in it, or gun range, sorry, wrong choice of words. Firing station, it's there. It was used as part of the armory. There needs to be some remediation, but that would need to occur with any project that occurs there. So they would have a firing range. They have a nice big outbuilding over there for a gym. So you're not building the walls all over again. You're just renovating the roof, putting new windows in, things like that. The other part that we'll evaluate, because you have to, you're all going to want to see a nice chart with the options, is if that wasn't feasible, putting a whole new building there, demoing the armory and putting a new building, which would be the building we already designed across the street. Would just be putting it on the site and laying out the parking space or spaces around there appropriately. So those are the options we're looking at for the armory. But again, we are going to look at Washington Street because it's a very simple option to look at.
So the feasibility study will answer all those questions. That's the whole purpose for the request. What we do know, though, is the landmass surrounding that building is by a factor of 2 or 3 times what the landmass is at the current police department. So we know that land and parking is not going to be a restriction. My guess is what we learned from doing the community center with what we can do internally, and we've spoken to Joel perhaps about managing the project, we can save layers, literally layers of markups, doing it the old-fashioned municipal bureaucratic way. And that's why we think we can build this thing for close to half of what the first option was.
Okay, so I guess I have a couple of questions. So the purpose of this article, like, what are we going to get out of this article before we start talking about how we pay to build whatever we decide to build?
So this article is just an extension of what we already approved at town meetings, and you've got that report in front of you for those options. So you will get the exact same report for those 2 sites.
So it'll give us this, like an estimated cost for a new building at either site, or an estimated cost for the reno at that site.
Correct.
And will that cost be, I mean, I understand the town manager's enthusiasm for whatever his plan is with, like, the trial with the inspector general. I think that's great. But let's say that it doesn't happen that way, or we've had a history in the past of building construction projects. Like, oh yeah, my buddy here is, and that's one reason why we're looking for a new police station after 25 years as opposed to 50 years. So I personally would like to just, whatever I pay for it, I want to know that it's done right, that it's not going to come up again as a need for the next 50 years. So, like, will those costs be based on, like, if you had to do it the way we have to do all the other buildings?
Correct. So we would still hire what they call an owner's project manager for the project. That keeps us in our checks and balances. They coordinate with all the subcontractors and things like that. What Tom's referring to is actually how you hire the subcontractors and how you go out for bid with them. That's where you would say, so you'd still have the professionals doing all the work,
Right.
and you still have
Okay,
control of
that's
the work.
one control. All right, I guess my question is, will the feasibility study give us the price of these, like an estimated price of these possible options for build, to design and build, based on the way we would normally have to pay for construction projects, or just the way that Tom is anticipating doing this one?
The cost estimate will be prepared as if we didn't have
Traditional.
Tom's method in line just yet, because we still need to work out some issues with that process. It's a new process, as Tom mapped out. It's never been done before.
They'll look at it, if I may, Mark, they'll do the feasibility study based upon the traditional procurement laws. The only reason the Inspector General said that he would advocate and approve this new method that Mark and I have developed is because we have a firsthand example of having done that at the train station. That was a $10 million project all day long.
And he's willing to see if it would work on a larger project
As a
as a
test
trial.
case, right.
Okay. No, my concern was that I want it priced the traditional way in case, for whatever reason, the
Completely
trial
agree.
doesn't go through.
I envision like a nice chart, Carolyn, and you can't compare apples and oranges. It's got to be the same across,
Right.
same methods.
Like they did when we had, yeah, thank you. All right, I'll, Mark, then Becca, then anyone else on the committee? All right, we got a lot of audience. All right, then Mark, Becca, Laura, John, and then Jonna. And Mark will remind me when I forget in 2 minutes.
Thank you. Through you, on the Armory site, currently, there's not a ton of parking. You know, it's in and then to the left. Are you going to be utilizing the other side that's lawn, so it'll be an in and an out almost, sort of?
Yeah, I mean, we got to work out those details. Once we get into it, we'll be able to answer that question.
And then the other thing is the corner property is also ours, right?
That's going to be part of this project, yes.
So we can park.
So that's
that'll
gonna
be parking also.
We're gonna, so parking is not even gonna be a question with this site.
Right.
We'll probably have double the parking spaces we need. I mean, if the police department wants to hold regional meetings at their place, they probably will have the parking for it.
Now on that corner site there now, there's the drainage or no? What's on that now? It's drainage, right?
It's a detention basin, yep.
Detention basin, okay.
But there's also a parking lot right next to it.
Right.
We own that parcel, yeah.
Right, so you could potentially tie into that.
It's all
your
gonna be,
additional
we're gonna
parking.
have that as part of the project. So those two parcels will be contiguous.
And then use that retention. Okay, thank you.
Becca?
So I'm putting on my Joel hat. Joel had 3 questions. Number 1, clarification. The article and the corresponding motion includes the final work product will be, quote, schematic/conceptual documents, but the supporting, end quote, but the supporting proposal from the architect, Dorr and Whittier, only includes updating the draft feasibility study with additional conceptual designs, which is correct.
So what these actual details of the scope of services is listed in your back information. That's exactly what they'll be giving us. So that the wording of whatever it is, schematic versus conceptual versus whatever Joel's saying, it's not really relative. Joel's referring to the architectural world. What we have is a scope of services of every task they're providing us as a part of your backup.
Okay. Well, when he watches this back, he'll know.
He called me today too, and I explained it to him.
Second question from him. If this article passes, will there be any community input into the project prior to a final decision being made?
I don't think we typically ask for any community input, do we, Tom, on projects? Okay, it was a joke. Jeez, nobody's laughing. It's too late.
Okay.
No, obviously, I mean, Tom's very good at holding public information meetings, which is great. I mean, it sounds
We
like
would
they're saying-
recommend it.
saying that in a cocky way, but I mean that as a compliment. So I think there'll be a lot of involvement.
Okay. And then third from Joel, the draft study, which has been distributed to this committee, has estimated project costs for a new police building in the parking lot next to the existing. I know we already talked about this. I got to ask. Is it safe to assume that if this were located at a different location, the project cost would be the same order of magnitude?
Yeah. I mean, it's tough to answer that question. I mean, I guess I can answer one question. If there was a new building being constructed, we have that information. If we're just putting it on this site or that site, that cost is going to be about the same, right? It may be a little cheaper because you're not demoing a building in some of these situations, right? When you're getting into the addition renovation part, that's a loaded question. You have to get to that feasibility study to answer that question.
Well, I've done my due diligence. I've asked Joel's questions.
Very good.
I have one for myself, though.
Sure.
I know this comes up. 2 questions altogether. Number 1, with the fire, it was important that it was in a certain location based upon, response times. Do the police have that same requirement? I would assume not.
Ideally, it has been great that our police department is right in the center of town. So there will be some concerns that we have a police station up in North Stoughton. But our officers and our cruisers have sectors of town, and they're assigned to those sectors, and they're on patrol in those sectors of town. So our response time is not geared the same way as the fire department.
Okay, I assumed that. I know when I've called not the non-emergency line, a cruiser's like 2 seconds away. And then my other question is, for the armory space as part of the feasibility study, are there wetland concerns back there?
There is a wetland in the far back, just off the rear to the property. Not concerning. The existing parking lot is within the buffer zone to the wetlands. You can actually work within the buffer zone to wetlands. You just can't work within the wetland itself.
Okay, thank you.
Okay, yeah, Laura, then John, then Jonna, and then Arnie's next after that. All right.
All right, so Becca kind of stole my question, but not completely. So she was asking about wetlands, but I know over the years that section that's like Turnpike Street has sunken repeatedly. It seems like it's been kind of stabilized now, but I'm assuming as part of the feasibility, there'd be like an environmental assessment and all of that good stuff. But thinking about building a new building there, first of all, and if that would have any impact. And then also, if there was an impact and there was a problem, we wouldn't want the police to be stuck in, a sinking area. Yeah.
Yeah.
Exactly.
So if you remember, we had this discussion about the fire station project, and a lot of people were wondering about the wetlands and the buildings sinking in the wetlands, and questioning our engineering staff and all the professionals
That's
on the
not
project.
what I'm doing, Mark.
No, not you, but you brought it up. Because I went on public record back then saying that no, there is no wetlands where we're building the building, but there was a lot of people questioning that. And it actually turned out to be the exact opposite. There was ledge where the building was. Wetlands don't exist on ledge. So for this site, you bring up a good point. There is a causeway, we'll call it, that is sinking over time. And that the reason for that is because they actually built it on peat. On peat. They actually built it on peat where a wetland was. So the wetland went right across the street. And in wetlands, there's a lot of bad, poor soils like peat. Peat isn't even a soil, it's just decomposed material. Organic matter. And that's why that settled. Over here, the first step you do is test pits and borings. There's no wetlands where the actual building's going to be, but you design from the top up, from the bottom up. So with your foundation, so they'll do the borings. I mean, if there was peat, which I can say with 99% surety there is no peat, they would have to remove the peat and drive piles down to build the foundation. If they had to do that, we will probably be stopping the conversation at that point.
Okay.
Yeah.
I figured you all over it, but just had to ask.
Thank you, John.
The Washington Street site, are you considering Phillips Screw?
No, that's a good question. This is the other way, down south where the DPW has their storage bins and material in it.
All right. To the gray of my hair, I can see I'm quite old now. And I remember the original 26 Rose Street, which was basically the size of about 1,000 square foot house. And then when that was torn down, the police was moved to the Armory for about 2 years. And then that's when the new 26 Rose Street was opened up. And through family, I've been through all those buildings and everything else, many memories in those buildings. And the thing is that when we did that in 1999, we kind of ignored, the Armory was brought up as an option. And the town said no at that point in time. What's changed in the past 27 years where we're now looking at that as a viable site again?
Because we got a $50 million estimate on the building going across the street that says it's not even a feasible site after we go through that process. So I think that's essentially what's changed. We got more information, more data on actually building a new police station where the police station is right now.
Did we own the Armory site at that time? I didn't think we did. So there would have been a purchase cost of the Armory site.
Okay.
Because as can say, I remember it too. So
Through you, Madam Chair, if I could just add a couple. We didn't own the Armory. 2, 26 Rose Street was just the renovation because they kept the original foundation, which is added to some of the problems with 26 Rose Street, is they band-aided 30 years ago, and when we took occupation of the building again was 1998. So we went temporarily into trailers and moved the department out of 26 Rose Street, which is a significant cost to the town, put us up to the Armory temporarily for a year, and then moved everybody back. And they did not build, and they took things out of the original 26 Rose Street when they were doing the renovation, like an elevator, wasted space, all the things that are the negative that are impacting us now, is they didn't build for the future. And that's why 25 years later, we're talking about the needs of the department not being able to be fulfilled in 26 Rose Street.
We are before the Finance Committee. Perhaps I can make a comment about finances. The reason we're doing this is we cannot afford a $55 million building. We don't have the debt capacity to borrow $55 million and ever build another school in our lifetime. So that's the reason we're being creative. It's not just that Mark and I love the challenge. It's that we can't afford to build a new department and can even less afford to build a remodeled building on the current site for $55 million. It's out of the question. The second problem we have is if our bond rating is negatively impacted in any way, borrowing that money will cost us an extra point. So on the $100 million for the school, the police department, and the fire department, that will increase our debt service likely by $1 million a year for that 1 percentage point. So it's not just what we want, where we want it, how we want to build it, what approach we want to take. We have to be able to do this project for under $30 million. And that's, in my view, the only site we can do for under $30 million. Mark and I debate every day. The second site, frankly, and he's the expert here, I believe is a waste of money because a new building is going to cost us $50 million. And it's a non-starter the day we get the feasibility study report. We cannot spend $55 million.
Donna?
Thank you through you, Madam Chair. I'm asking these questions for someone. The funding sources for construction, what funding mechanisms are proposed to cover the actual construction costs?
This article is for a feasibility study. It's 200,000 for free, free cash biz. Free cash.
That's for the feasibility study, but not for the construction costs, because that's something that's going to come later down the road, so you don't have any proposed answer
We
for
got to
that.
complete step one.
That's what I figured, okay, but I'm asking because they asked me to ask. Okay, and then you already answered that one because you discussed the urgency of why you need it. And will the planners and the project managers adhere to the most economically efficient pathways to meet the project's requirements? Can you outline how cost effectiveness has been a primary consideration in the project design?
Yes. The model is what we just did at the community center. There were no less than a half a dozen layers of people that got to get their profit and overhead. With the engineering staff that we have and the project management team that we have, there are so many things we can do internally. And I'm not talking about Joe from down the street giving us his used windows. Everything in that community center is the highest of quality. And we did it for 25% of what it would have cost had we done it a traditional way. And so to answer your question, if we do it the traditional way, we'll be priced right out of the market. That's the reason we asked the Inspector General to come here and talk about all of the layers that drive up municipal costs. There's got to be an end to that approach. And we know how to do it with Mark's leadership and his staff's talent. And we're going to ask them to design something where we take into consideration all of those bureaucratic steps that make it 2 times, at least twice what it should cost. I hope that responded to your question.
Thank you. And I think there was one more. They asked if a modular police station could be used in the interim as a solution during the renovation.
The current police station would remain occupied until, should it be the Armory or the other site, is complete.
Thank you.
Okay, Arnie, you were next.
Thank you. I think Tom partially answered my question, sort of. And you completed it successfully. Yes. My question is, going beyond the feasibility study, I don't know, pick a number. Say it comes out 25 or 30 million. It has to be under 30 million. So pick a number somewhere under 30 million. What do you have in mind for financing the police station? Are you going to be doing a debt exclusion for that, or will we finance it on our own?
Way premature we haven't even looked at that. Once we know what the cost is, we'll get with our bond counsel. We'll get their counsel, their advice, their recommendation. We'll come before the finance committee. We'll come before the select board, and we'll go before town meeting as Mark did with you on the land next door, as to what your advice and counsel is. We're really into the collaborative approach, and we'll get a lot of feedback before any decision is made on that.
Did you have anything in mind? I mean, do you think we could possibly finance it through the income from our commercial?
I wouldn't
property
try to
taxes?
speculate on that right now, Arnie. We don't know if the project's feasible. We have to go through this first step. If it's over $30 million, we have to go back to the drawing board. So no, we haven't thought about that yet. To me, that's like designing the fourth floor before we've designed the foundation, how we're going to pay for it. We may not be able to afford it. It could be that simple, but that's what the feasibility study will tell us.
Okay.
And we'll look at every approach and
Thank you
present
very-
it to the public.
Thank you very much. I appreciate your input.
Thank you, Arnie.
Sorry, I keep pressing the button to make sure it's on and I accidentally turned it off. I apologize. Any questions from members of the committee? Any questions from anyone in the audience or anyone want to speak on it? Lisa, come on up.
Hi, Lisa Lyons, Precinct 2. So I would like to commend leadership here on this for calling in, I believe you said it was the Inspector General, and saying enough is enough. Municipalities cannot take these exorbitant prices. And so I do want to give credit where credit is due. So the second issue, and I do recognize that that's a function of something I voted no on, so the train depot. So the other issue, I just want to reiterate, when we do get to, as part of the feasibility study, design is a consideration. I just know projects in this town, I know everybody wants the nicest and the best thing ever, that somebody start listening to the taxpayers. We can still have something nice that's frugal and economically designed. And oh, by the way, the last thing, that it doesn't leak. We have in a lot of our projects, a lot of HVAC problems. So could we pay extra special attention to that? So thank you.
Thank you. Any other members want to speak on? Come on up.
As is commonplace, mine is about the longevity of our planning. Does the police department have a, what do you call the special fund?
A stabilization fund?
Thank you. I'm still becoming familiar with the terminology.
Through you, Madam Chair, to the speaker, there is also out there what we're calling a building stabilization fund. And so that is funding that's available as of, 1 second. Building reserve currently has $4,450,000. And the goal of management is to continue to fund that so that we can help defray costs when we move forward on different projects.
Is the police department in particular contributing? I mean, I don't really know how the increase of each stabilization fund works, but is this department that has this need in
The
addition?
stabilization funds are funded through town meeting. We make appropriations through articles to say right, last couple of years, we've had an awful lot of free cash because Biz has spent an awful lot of time closing out old articles and collected a whole bunch of money that was just sitting around in various places that we didn't know about. So we've had like free cash of like 10 to 12 million in the last couple of years. That's not real. That's not going to continue. All right. And that's not a consistent.
I love it.
So
She
we
said
have been putting that money in the stabilization accounts. Usually the goal would be to try to deposit into them as we, each year, so that it's a savings account. But some years money will be deposited more than other years, depending. At least that's I see that happening going forward.
Correct.
Ian?
Thank you, Madam Chair. Just, this is probably more general finance question. So with the stabilization fund, especially for buildings that could apply to probably any number of properties, is there any guidance on, there's 4 million, so let's say we go forward with a $30 million project. Is there guidance, like, do you draw down the full 40 million to reduce the total borrowing because you have a project on the table, or do you do a percentage and keep some back in the stabilization fund?
The most prudent approach, and not just this community, but any community, is to make sure you do leave money in your stabilization fund. You do not completely wipe it out. But as we go forward, the more we put in, we can use some of that money maybe for furniture and fixtures, things like that. So not necessarily borrowing up to a huge amount, just like we did with the South School. With the South School, we had extra money from the high school. We're using that money to reduce the borrowing for the South School. So that's your financial prudent planning as you're moving forward. And yeah, the borrowing articles that we may have, we can potentially reduce any future borrowings.
Thank you.
To add on one sentence, another consideration is the cost of money at the time. We may use more reserves if the interest rate is up, less reserve. If we can, for instance, the high school, the town at the time borrowed, I think, $80 million because the former town manager, Stephen Astis, was able to negotiate an interest rate that was 1.75 below market. So that was a very prudent decision at the time.
Lisa? This is a little bit of a technical question for our finance director. So I heard this and I just want to know what is technically the way it happens. So you just said how we took extra money from the high school and put it so that we reduce the actual borrowing for the South School. Now, I hope I say this right. So we appropriated the full $114 million for the South School. Somebody told me, and I just want to know if this is true, through bond counsel, that because the town voted for the $114 million, that we actually have to draw down the full $114 million to get that $42 million of MSBA money. And that statement I just said seems incongruent with the fact that, oh, we're reducing the borrowing at the South School. So could you help me clarify the seemingly?
Sure. Required when you're doing a large borrowing, although you have other funding sources like the MSBA, you have to go out and authorize borrowing for the total project. In this case, it's $113 million in change rather than the 114. Now, with that borrowing, what we've done budget-wise, it remains the same. That budget is not changing. It's $113 million, period. But what we've done at town meeting is we've authorized that $4.571 million be used to reduce the borrowing authorization. Now, we can't reduce the borrowing authorization until the project is complete. It will be rescind borrowing. But the way the budget's set up, it shows this is what we're going to borrow, this is what we got from other funding sources, and this is the town's obligation, which would be the excluded debt that was voted at town meeting. So the statement was basically incorrect. So
You just said it. You said the word that connected it for me. You said the word is, while we have to do it all now, we can rescind it later. So the net effect is we're not going to do it. Right. So they do marry. Okay.
And it's the same type of thing that we're doing for the fire truck, the ladder truck that we're doing. We authorize the borrowing, but we aren't going to take that borrowing once we get the invoice in. We're going to be moving the money from fire apparatus stabilization fund to the project to pay for the project without borrowing.
Thank you for explaining that. I appreciate it.
No problem.
Okay. Any other questions, comments on the police station feasibility study? And the funding of this is coming from free cash as well, I believe, right? In case I forgot to say that at the beginning.
I'd like to make a motion, if possible.
Oh, if it's the one I'm thinking of, I would dearly love to hear that motion.
I would like to make a motion to continue the public hearings to Thursday, March 12th, 2026.
Second.
So the motion has been made by Mark and seconded by Becca to continue both the public hearings for both the annual and special town meetings of May 4th to tomorrow, Thursday, March 12th at 7 p.m. here. All those in favor of that motion, say aye.
Aye.
All those opposed? Okay, and all right, the next motion I would like to entertain is probably our favorite. Got a motion to adjourn?
I'd like to make a motion to adjourn.
Second.
All right, so you have a motion to adjourn made by Mark and seconded by Jonna and Becca. All those in favor say aye.
Aye.
All those opposed say and stay. Meeting's adjourned.
Thank you all for your time.